فورم إن شاء الله حتكون فيها خير جدا كبير. أمس كلكم حاضرين وكان في يعني very distinguished leaders و distinguished speeches. كانت صار في يعني presentations عن ال value based، عن staffing، ال advanced nursing practice role، وكلنا نعرف الآن with the transformation which I will be talking in my workshop about what do we need in the future. قبل ما نبتدي السيشن I just want to يعني in mind leave one question, one statement. إن ما شاء الله تبارك الرحمن يعني it amazes me when I look back وأشوف الsuccess of the Saudi nurses. It's amazing. And I cannot recall one case that is not successful. صراحة. If you look at each one of the leaders الموجودين على الساحة from all levels, you will witness in each one have really strived his best and they have really accomplished big. What we want in the future, not as much as we say about success, it is about the impact. Impact. What do we want? I think it's much easier to do the success, which all of you, alhamdulillah, has been very successful. And the hardest part is leaving the impact. And what happened yesterday is gonna leave the impact, inshallah, for generations. وأحب أني أنا يعني أشكر سعادة الدكتور محمد الغامدي وكل الفريق والساينتفك والorganizing for pulling this very important efforts behind it for making this dream, this history a reality. والحمد لله أن كلنا عشنا ويعني we witness هذه اللحظة إن كنا فيها في ICN. صار عندنا platform. There's so much great things happening for the last 4 years that make all of us, in spite of all the challenges, to be very optimistic. Inshallah we are. It will be my pleasure today to introduce a well-known icon in nursing that we all know her since we were students, Dr. Fatma Rifa'i from United Emirates. Dr. Fatma Rifa'i, she has more than 30 years in leadership roles, upgrading and promoting nursing services, education, regulation, and professional identity in United Arab Emirates. Through establishing the Federal Department of Nursing, the UAE Nursing and Midwifery Council, and the Emirate Nursing Association. She is involved in international, regional, and national projects that she has led and provide consultation and advices. This includes, for example, working with the WHO, IMRO, ICN, and United Arab Emirates Women Union, and being a member of several national, regional, and international professional organizations, including Board of Directors of the International Council of Nurses, Board Member of Emirates Nursing Association, and members of the Commissioning on Magnet A and C. It's great to have here. The mic is yours, Dr. Fatma.
Bismillah ar-Rahman ar-Rahim. Assalamu alaikum. Sabah al-Khair. Good morning, all. I am so privileged and proud to be with you today. So happy to be with Saudi Nurses Association members and nurses from Saudi Arabia and from all around the globe, I guess. And thank you very much for inviting me. This is really a very important moment for Saudi nursing profession, history, and actually for the GCC, for all of us. Today would like to talk about transformational leadership. and its relation to nurses' well-being and quality care. And I selected this topic because leadership styles been studied, been implemented, been discussed. The dialogue around it contain a lot of theories and various point of view. And it is very important to address the leadership issue, because the research and the evidence showing us that there is a direct relationship between style of leadership and patient outcome, which is very much related to nurses' well-being and positive work environment. So I thought this is a very timely and important topic to discuss today, and I think it is addressing addressing an important objective and theme of your conference. So when we talk about transformational leadership, we need to go back to James McGregor Burns, who was really an expert in leadership and started documenting leadership styles when he was writing biographies for presidents of the USA. And we are learning from him because of his experience and vast case studies that he documented in the literature. So he says that transformational leadership, where you have the leaders and the followers helping each other to advance to a higher level of morale and motivation. And listen to this, it's not leaders, both leaders and followers are very important component of this formula to advance organization, to advance leadership issues within the organization, and certainly for us within nursing. It's this very important, unique aspect of this leadership style that inspires positive change in those who follow. It is very important ingredient that change should happen in the organization, within the team, within the members to reach to the goals. It's not, they don't accept the status quo of what's happening around them. And they are not concerned about the process or the organization or per se, but also very, very much they are concerned about the members of the group. They want each individual to succeed within the organization through the process of achieving the objectives. And in our case, achieving good care, quality care. So in general, briefly, two main attributes were identified. These leaders causes change in individuals and social systems. And this is a very important aspect of transformational leadership. Not change in the leader itself, not change in the process or the organization, but in the individuals and social systems, which means related to, of course, values and culture of the organization to deal with. And also, very important, unique characteristics, they develop leaders. Their team members and their followers are expected to be leaders also. So that's why there is very much individual focus in this kind of leadership. 4 elements of a transformational leadership: individual consideration, intellectual stimulation, inspirational motivation, idealized influence. So I talked about individual consideration, that the leader not only focusing on his or her own success and achievement, the focus very much on individuals. So they try always within the big picture, within the big team, big organization, to focus on individual need and individual capacities and potential. And when individuals they have problems or they have any issues that are probably hindering their process. So there is the individual don't feel lost within the group or within the organization. Each individual within the team feel empowered and feel that the leader is really caring for them individually. So it's not about considering only the organization on the expense of the individual needs and the individual situation. That's why the team members, the followers, they are so committed to work with this leader and to work towards achieving the objective of the organization. Intellectual stimulation is very important because the leader allow them to ask questions, allow them to maybe bring different perspective, different attitude, different issues. They are not afraid of being creative. So creativity bring along a lot of advancement in the workplace. Inspirational motivation, very important. I'll talk about it a little bit more later on, how the motivation of this transformational leader bring inspiration to the team members and make them feel proud to be part of the team and of the organization. And idealized influence, they see the leader as role model. The leader is committed to ethical practice. They see the right way how to do things and how to advance the work within the organization. So the members of the team they feel committed and they feel they are part of the organization, part of the team, and kind of they want to work for this leader because of the values, because of the ideas and the vision that this leader has brought to the organization. And there are underlying beliefs of this transformational leadership style that brings all the concept that I talked about a little bit. So the leader believes that the individuals bring multiple perspective, experiences. Each one has different potential and different ideas. So bringing these together is a blessing and power for the organization and for the objective and the vision to be achieved. And that the legitimacy of the leader comes from the followers, not from the position, not from who is this leader or how the leader looks like, or it is actually from the followers. So the followers, the team members, because of their commitment and because of their belief in this leader and in his vision or her vision, they give this leader the status of being able to achieve and succeed and bring everybody to look at the vision and to believe this vision theirs and to achieve the objectives. And the capacity of the followers is developed. Always there is the focus of developing the individual capacities. As I said, the individual is very important for this kind of style. So, and they accept the leaders put in the followers this notion of that they are able to do outside their potential, outside the box that they perform beyond their expectations, and that's this belief bring very strong leadership style and bring the potential of followers into the organization. The mechanisms of how this is done was introduced by Bernard Bass later on, And as he was expanding on the theory of our previous expert in leadership. So the mechanism is basically to enhance motivation, morale, and performance of the team. This is basic principle. Connect their sense of identity and self to the mission. The collective identity of the organization is very important. The identity of the followers of the team members are in line with the vision and mission and objectives of the organization. Being able to do this is a very powerful attribute of this leadership style. And as we said, being a role model is very important. This role model inspires team members to achieve the objectives and the mission and the vision of the organization. There is always a challenging that this leadership challenge the team to take greater ownership for their work and their performance. It's there is ownership feeling that the member of the team of this leader is experiencing. And understanding their strength and weakness is very important, because this is the way to help when there are any weaknesses. And then very important to align the team with tasks that optimize their performance. It's not to give them tasks that they are not able to do, and so and that their weakness will appear, and the fear of how to continue will minimize their potential and their the way they work with the leader. So very important, and we see in nursing, in our experience, I'm sure many of us have experienced this, how especially those who are starting the profession, when we are given tasks that we are not mastering from the beginning. The ideal thing is to give the person something that they do well and they feel good about it, so that the success will bring success, as they say. So there are so many leaders, of transformational leaders, I'm sure you know, and around us and in different disciplines. And I just want to mention that, well, we know of Florence Nightingale. Her transformational work have brought modern nursing and that we know now, and we expand on, and we make more advancement in our nursing. In addition, of course, we do have our own, our culture and our Islamic culture, our leaders in nursing. Margaret Style, her leadership transformational because of the way that she brought not only to the USA, but to the global nursing community, the change in education and the change in regulation specifically, which bring me to talk about Fadwa. Fadwa, we know Fadwa from the region, originally from Yemen, but she's now in Scotland. For, of course, many years she's Scottish, but we always believe that Fadwa is from us and from this region. Fadwa transformational leadership style have helped a lot of us in our region, our countries, to move our nursing profession to a very positive direction, especially in education and especially in regulation. Her education footprints is very well known in Bahrain, and her regulation very well known in UAE, but also I'm sure in another country. So we are celebrating these transformational leaders in nursing, and I'm sure we will have many of them in the future, and we do have around us also. Why transformational leadership? I think it is very relevant to nursing, and you can see that the Magnet model of the Magnet program, which will be presented during, or have already been presented in the conference. Magnet is a recognition for excellence in nursing. One of the forces of magnetism is transformational leadership. It's very important because these leaders are able to provide the workforce environment that assure well-being for nurses and bring structural empowerment and professional practice and new knowledge, innovation, etc., into the organization through their transformational leadership. So this model, as you know, and I'm sure many of you have seen, put transformational leadership as very important component to be achieved in order that the organization could be recognized as magnet organization. And basically because these leaders focus on the well-being of nurses, focus on work environment standards, which bring very important change into their professional practice. And at the end, you see the outcome, patient outcome, and the empirical data is achieving its maximum potential. Now, it is reflected in Magnet, as I said. This is in the mission, vision, and the resource advocacy that the leaders focus on, the influence of the leader in the organization wide and introduction of change that benefit the well-being of nurses and patients. And the leader is a strategic partner in this organization decision-making. They are on the table of decision-making because of their transformational leadership style. These nurse leaders are able to lead very, very important, able to lead effectively through change. And they do bring advocacy, and they focus on mentoring and succession planning. Very important for the well-being of nurses in the organization, these two concepts of mentoring and succession planning. So we can see that transformational leadership is a leadership style that is relevant to nursing, and it's reflected in the Magnet component to be attained if we want our organization to reach to the standard, to the excellence. Of course, excellence in nursing can be also achieved not only through Magnet, but through other processes and other way of leaders focusing on well-being and on positive outcome in the organization. Now, I would like to share a small story, and this story is brought to you through my reading of Well Done, The Power of Positive Relationship. This is very interesting small book. I'm sure many of you have looked at it, and it has been published by a famous writer, Ken Blanchard, with his colleagues. This story is basically on, very shortly, briefly, I will tell you that businessmen have visited SeaWorld and have seen these whales, big whales, killer's whales. Actually, they are known to be powerful, strong, and could kill also if they are threatened, if they are aggressive, could be aggressive. And he found that these whales are very well trained, and they are making very good performance that bring joy to those who are watching. And he was astonished how this trainer, who is riding actually the killer whale and being so close to the whale. After the show, he was very, of course, astonished. He was thinking back home. He had problems within his organization and within his family of not having positive relationship, and there is no motivation, both in his organization and at home, specifically with dealing with his children. But basically, we are now looking at the organization where his employee and team members are kind of lazy, not motivated, and he was worried that he's going to lose his job because of this. So when he met the trainer told him secrets of how he was able to build positive relationship with these whales and how they are able to perform to their maximum potential, and they are actually enjoying what they are doing, according to the trainer. Because the businessman said, "Hey, do you make them hungry? So do you punish them?" Kind of. In our organization, this is what some leaders will do, to make them do whatever you want to do. He said, "Not at all. We don't. We create positive relationships with our whales, And why this positive relationship is helped us and helped the will to perform and to enjoy the whatever activities they are doing. And he told through the discussion and the dialogue, it's a long story, but briefly, the trainer told him to build positive relationships and to benefit of the power of this relationship. First of all, build trust. We make the whales trust us. We give them time to understand, to feel comfortable, to trust us. And this is important. You remember your colleague nurses when they start nursing profession during whether orientation or whatever we call it, internship. Trust is very important, and trust needs time. Very important. And that's, he said, be patient. You have to be patient and build a trust. The second, emphasize the positive. Always emphasize the positive for people. Catch people when they are doing something right, so you can celebrate. They celebrate, they feel comfortable, they feel happy, they want to do more. If you catch them doing something wrong and you punish them, they feel bad. They might not be able to contribute. They might do something for you because they are afraid of your punishment, or you're not feeling good about them, and this will go very quickly. So then he said, when mistakes occur, redirect energy. Don't put the energy on the positive feelings at that time. He said there are 4 kinds of responses to performance: no response, negative response, redirections, positive response. So, and usually he said in our organization, most of what we do when somebody have done a mistake or they came low of our expectation, they don't receive response. You remember there are times where the whole year, months, we are working, or nurses are working, and nothing is said until time of evaluation. All the bad experiences, whatever is missing during the process of working together, being brought. This is no response that is not effective for motivating people to work to their maximum. Or the negative response is when you blame and when you punish and when and the focus on negative response. Why this happened, what happened, etc. But the 2 effective responses: redirection and positive response. With redirections, the leader, the trainer, he is advising now our businessman. Remember in the story, as he's listening to him, he said the leader would be successful in his process if you describe the error or problem as soon as possible. Don't wait until the time of evaluation, after 3 months, after 6 months. Clearly describe the error without any blaming. So you describe what happened or what you don't want to happen. And then show the negative impact. It might affect patients, it might delay this, it might do, without blaming again. And if it is appropriate, and usually it is appropriate, but what many of us don't do, take the blame for not making the task clear. There are many times we don't explain to our team members what exactly they should do, what exactly they have to do, and also time of explaining. There are times where we give them instructions or explaining, and they are anxious or they are tired, and they don't, later on they will not remember. So take the blame, say, I am sorry, maybe I did not explain what should be done clearly. Go over the task in detail, make sure it is clear, understood, and express your continuing trust. Trust and confidence, very important. Always express to your team members that you you trust them, and you have confidence in their potential and responsibility. And remember, the belief is that everyone of us, we have potential, we have willing to, all of us, most of us, willing to work to achieve positive objectives. So this is very important. And then to continue the positive response, you need to praise people immediately also. Also, as you want to address their mistakes quickly and not wait, also address their success immediately and praise them. Don't wait, and then the effect will be less as you want. Be specific about what they did right. Identify, you have done this very good. Your team member is very grateful for your help, etc. Share your positive feeling about what they did. Encourage them to keep up the good work. Catching, as I said, catching people doing things right rather than catching them doing things wrong. And catching people doing is so easy, right? I mean, every time you could easily say, don't do this, you did that, etc. And this blaming bring very negative atmosphere and will not help us in building positive relationship for our employee. Praise, progress, it's a moving target, which means that you do it slow, you do it every time. Every time, even small success is being provided, you do praise progress all the time, and even if it is small. Well done only works when you are sincere and honest. This is very important, of course. If you don't mean it, if the team members feel it. They feel how whether you are honest about your willingness to build positive relationship. Why a positive relationship is important for us? Because it's bring good, healthy work environment for our employee. It is part of building very positive well-being for our team and our staff and our members in the organization. And certainly, this affects the way that nurses provide care, and this brings positive outcome for our patient and for our community. I thank you very much for listening.
Thank you very much, Dr. Fatma. It gives me great pleasure to introduce Dr. Turki Al-Mutairi, our colleague, who obtained his bachelor degree in nursing from University of Southern of Queensland in Australia. He obtained his Master of Advanced Nursing Practice from Griffith University, Brisbane, Australia, and then Doctorate of Philosophy of Nursing from Monash University, Melbourne. Dr. Al-Mutairi has 17 years of experience at Prince Sultan Military City in Riyadh, led him to reach the top of his profession as an executive nursing director in Prince Sultan Military Medical City. With his long list of achievement, I'm proud to say that he deserves it, and it's well deserved, to say it betterly. Dr. Turki Al-Mutairi has significantly contributed to Prince Sultan Military Medical City, nursing transformation, and worked extensively in various committees and Saudi Patient Safety Center. Please welcome with me Dr. Turki.
Thank Thank you, Dr. Ilham, for the nice introduction. My pleasure to be here in the first Saudi Nursing Association's conference, presenting in front of my colleagues and senior executive nursing CNOs and from various hospitals at Saudi Arabia. So my presentation today is actually, it's maybe well known for most of you, but today I want to just give some more enlightenment on the overview, nursing outcomes and comparison between Magnet and non-Magnet hospital. However, there is still significant gap. We don't have, anyone has looked at the comparison between Magnet and non-Magnet hospital in Saudi Arabia. So the outline will be, briefly, we will talk about the nursing workforce and milestone nursing, and then what is Magnet, recognition for those who first time to hear about it or wants to know what is Magnet, and then nursing outcomes, which is nursing sensitive indicators. We're not going to look at all of them, but some of these. So, okay, then we will talk about some challenges facing maybe Saudi context within nursing, and some recommendations that we think, and also inspired from some literature, recent literatures that we look at nowadays. So we all know that nursing workforce actually is central rules for providing quality care and patient safety, and essential for human resources in all hospitals. Recent literature as well says that clinical nursing is a high pressure job due to required intensive amount of social interaction and the complexity and unexpected changes in patients' care. All of us, we know that we have high service demands and a critical shortage of nurses, and that's make it even worse recently in the last 2 years. And the critical shortage is due to a high aging workforce, although we don't have actually solid evidence here in Saudi Arabia about the aging within nursing in Saudi Arabia. According to the World Health Statistic Analysis, there are approximately 29 million, and I can see as well some references yesterday that they mentioned 27 or 26, 25, but actually recently in 2020 from the WHO Health Statistic Analysis, there are 29 million nurses worldwide. However, we need, according to them, 1 million nurses to further needed by end of 2020, but we don't think that we reach this 1 million even though. According to the statistical, MOH statistical book in 2020, we have 196,000 nurses here in Saudi Arabia. However, 42 only are Saudi citizens. We can see in this manpower in KSA, and that's driven from the MOH statistical book from 2016 up to 2020. And if you can see in 2019, we have 1,099,000 nurses. However, 2020, we decreased by 3,000 nurses. And that will give as well hence that we have difficulty in recruiting staff or even have more graduates within the market of nursing. So only milestone in a nursing profession. And the most important date is 1954, when the government of Saudi Arabia has announced that nursing profession is a job or a profession within the healthcare institution. And if you count it from that day to today, it's only almost 65 years. So I assume that we're still novice even within nursing profession if you compare it with UK, Australia, or United States. However, we can say, and we can be proud of ourselves, that we are actually moving forward through the profession of nursing within Saudi Arabia. So briefly about Magnet. Magnet for all of us, is American Nursing Credential Centers designed to provide a framework for nursing practice and research in the future, and as well serving as a roadmap for organizations seeking to achieve Magnet's recognition. It's provide framework to create work environment with an excellent workplace culture and the highest standards of care and exemplary patient outcomes. And it's awarded to a healthcare organization that meet the American Nursing Accreditation Center for quality patient of care. So this is their model, and it's well known, and our guest speaker ahead of me, she actually put this model. So research says actually showing create a positive professional environment for nurses leads to improve outcomes for staff, patient, and organization, and actually it's cost effectiveness as well. So what is the benefit of Magnet accreditation? It's actually the main benefits is attracting and retaining top talents in nursing within the healthcare organization, improve patient care, safety, and satisfaction, and foster collaborative culture, advancing in nursing standards and practice, and grow business and financial success. So what is the nursing outcomes that we're talking about? So whenever you hear word nursing outcomes, you're actually talking about patients and client health status that influenced by nursing interventions. So we do interventions and we need to look at our outcomes. And it's mostly recorded in a specific time for opposite of care. It's a term to use in both a nursing minimum data set and nursing outcome classification. So nursing sensitive measures reflect the structure, process, and outcome of nursing. And the NSI articulate the value of nursing's contributions by measuring elements of patient care and patient outcomes, and that are directly affected nursing practice, which is actually implementing the Magnet model or framework. So Donabedian model for evaluation quality of care that's been used by the Magnet Accreditation Center. They actually look at the structures and process and patient outcomes. And this model, for those who doesn't know, is used by top leaders to see the outcomes of a hospital. So structure mainly is looking at supply, human resources, or infrastructure for a hospital. Process is actually looking at the coordinating care between patients and provider. And the patient outcomes, that includes not only nursing outcomes, but includes hospital outcomes. So that's in details what structure has been used through the NNDQI, which is nursing database for national quality indicator. They look at the structures, nursing turnover, patient contacts, RN education, specialty, and staff mix, skill, and the workforce per se. The process, they look at many aspects to coordinate the care between patients and provider, and that's basically including nursing. So they use a lot of process to try to measure the outcomes that we actually gonna look within nursing environment. So these kind of outcomes that actually look into when you're looking at nursing outcomes in any hospital, or any CNOs want to look if their nurses actually are having good nursing outcomes. It's include, of course, patient fall, pressure injury, VAB, CLABSI, CAUTI, and hospital readmissions, pain impairing functions. Another aspect that they look at is RN satisfaction. So they adapted the job satisfaction scales, which is called PES. So there are three important criteria for nursing outcomes. First, the capacity of attract and retain nursing who practice to the highest level, and high level of nursing engagement, and nurses' perception of good practice and environment. So what is nursing outcomes in Magnet versus non-Magnet hospital? We look through the literature and we see one of the biggest outcomes is patient experience. So this is one article done by Amy and her colleague. and they look at in comparison. They actually examine the relationship between magnet recognition and indicators for nursing excellence and patient experience with their hospitalization. They use the HCAHPS survey. That's briefly what kind of outcomes they look at. They look at patient rated the hospital. Did they advise the hospital for another patient? They look even nursing communication and staff explaining their medication to the patients or not. Their pain was controlled or not. So their major finding is magnet recognition is associated with better patient's care experience, which may positively enhancing reimbursement of hospital. And patient as well in magnet hospital give their hospital higher overall rating, were more likely to recommend their hospital and reported more positive care experience with nurse communication. So your patient is observing even your communication. And nurses in magnet hospital are less likely to miss care related to patient's education and call pill response and other nursing care responsibility that could directly affect patient experience. Another study was looking at implementing evidence-based, and they mainly look at the comparison between magnet and non-magnet. They actually determine whether individual organization qualities could be identified, and that were related to registered nurse readiness for evidence-based practice measures, evidence-based practice barriers, ability, desire, or frequency of behavior. And they included 14 hospitals within healthcare system. That's mainly, they included 14 hospitals. They include three hospitals were magnets and 8 hospitals were in the pathway to excellence, and 3 hospitals were non-magnet hospital. Their findings was the RNs employed by facilities designated by the American Nursing Credential Center as magnet or pathway to excellence reported significantly fewer barriers for evidence base than those who work in non-magnet hospital. So RN as well in magnet had a higher desire of evidence base than pathway to excellence or non-designated facility. So, and they link it that education or bachelor degree level or higher reported significantly fewer barriers to evidence-based. So it's linked, evidence-based actually linked, because magnet looks at qualification of a staff. They look using shared governance, how they actually implementing evidence-based. Compared to non-magnet, they are some usually are not really directed through a framework or guidelines. So the predictive model as well found higher evidence-based readiness. They think nurses are ready for evidence-based practice models when they compare it to nurses in non-magnet hospitals. So they link it evidence to their practice. They give some recommendation that applying model of magnet, even if you are not going through the journey, it's actually highly recommended. Another one as well related to evidence-based practice, but this one is looking at their knowledge, competencies, and monitoring of culture, monitoring and culture of evidence-based. They collected data from 2,000, more than 2,000 nurses. 1,600 nurses were magnet and 600 were non-magnet. Their mainly finding result, they find that magnet designated hospital nurses had higher score of evidence-based knowledge, monitoring and culture. However, they didn't find significant findings when it's come to competency, evidence-based competency, when you ask or require the staff to set for a competency and evidence-based. That's briefly as well about the evidence-based knowledge, competency, monitoring, and culture. You can see the magnet and non-magnet. All are significant within magnet hospital. However, competency hasn't shown any significance. That's briefly when they asked them questions about magnet and non-magnet related to evidence-based. You can see the blue bar. Most of magnet are and had higher perceptions or they understand question related to evidence-based practice. As we mentioned as well, and now reading the findings, Magnet designated hospital nurses had higher score related to evidence-based practice knowledge or monitoring or culture. There is no difference, as we mentioned, about competency. The third outcomes is related to the work environment, staffing, and nursing outcomes. That's this research done by Katniss and her colleague, and they look at the outcomes associated with Magnet and non-Magnet hospital. They actually look at the risk-adjusted rated of surgical 30 days mortality and failure to rescue patients or nurses reported quality measures and nurse outcomes and the practice environment scale of nursing work index. And it's involved 11 emerging Magnet hospital and 125 non-Magnet hospital. That's mainly the things that they look at, like nursing physician relations, nurse manager ability, leadership and support of nursing, staffing and resource adequacy, and the comparison between Magnet and non-Magnet. This is maybe one of the studies that been published a long time ago, and they look from 2000 till 2006. They look at the patient outcomes, and you can see their Magnet and non-Magnet. They look at the nursing reporting quality outcomes and nursing job outcomes. They look in a nursing job outcome, they look at the burnout, job dissatisfaction, or intending to leave their organization. The finding, I will just read the finding. Emerging Magnet hospital demonstrated markedly great involvement in their work environment than other hospital. On average, the change in 30 days surgical mortality and failure to rescue rated over in the study of their study were more pronounced in emerging Magnets. So they actually found the decrease of mortality within 30 days surgical, and as well failure to rescue, which is by 2.4 fewer deaths per 1,000 patients compared to non-Magnet hospital. And they have similar differences in the changes for emerging hospital and non-Magnet hospital, where observing nursing reporting quality of care and nursing outcomes. So they recommended that in general, Magnet segregation is associated in general, Magnet segregation is associated with significant involvement over time in the quality of work environment and inpatient and nursing outcomes that exceed those of non-Magnet hospital. This is another study as well of work environment by Kelly and her colleague. They look at the secondary database. They involve many nursing staff. However, they included a sample of 567 hospital, 46 in which were Magnet hospital and the other are none. That's briefly, they look at the generations and they look at the characteristics of the hospital, if it's a classified teaching hospital or non-profit hospital. They look at even at the bedsides and sort of things. They recommend nurses in Magnet hospital are significantly less likely to experience high burnout or dissatisfied with their jobs than nurses in Magnet hospital. And this is another study, however, do you have time, Dr. Ilham? Huh? Okay, so another study they found as well, compared and extended previous studies. This is in Belgium. Their study actually was interesting. They actually couldn't identify the staff or aren't they felt inadequate staffing in Magnet hospital compared to non-Magnet. Usually non-Magnet hospital, they feel that they are well staffed. They feel adequate resources. However, Magnet hospital, they didn't feel it, although it's only one study in Belgium, we cannot generalize this, but it's a significant and a gap that needs to be studied. So we actually say challenges here in Saudi Arabia, or recommendations that have been driven from these 7 papers. We have difficulties experiencing the recruitment nationals to undertake nursing education programs. This is still a gap. We cannot actually have more graduates and to fill up our needs in a hospital, especially with the expansions of hospital. High rate of exit from profession. The turnover rate range from 17 to 60 per year. Example, our hospital, the turnover reached now 22. We have lack of professional growth, especially for Saudis, with the 5 postgrads that lead them to senior specialists. We think a lot of needs to be done with the Saudi graduates to actually attract them to the clinical area. Of course, the low wages compared to other jobs, especially even for Saudis, their salary wage scale is not actually, I think, and many of my colleagues think that they are underpaid when it's come to the hospital or leading hospital. So recommendation, advocacy for nursing profession. I will just read the title. In Saudi Arabia, offering education programs, generating ideas, energy around nursing in Saudi Arabia. I think the Saudi Association Nursing now has well recognized even in hospital, and I can assure you that even in top management in a leading hospital, they're talking about Saudi Nursing Associations, and we hope that we can have contributions, and all of you has contribution in the Saudi Nursing Association. Employ strategies to improve nursing satisfaction, improve workplace condition, improve nursing decision making. This is some references. Thank you very much.
Thank you very much, Dr. Turki. That was really very informative, and it really goes with the, the remarks for Dr. Fatma early. Very interesting to see all of this information is being spread and the magnet. Our next, it gives me pleasure to invite Mr. Abdullah Nagala. Mr. Abdullah Nagala is the Chief of Nursing Affairs in the Eastern Province, E1, an experienced nurse leader with more than 30 years of extensive and successful clinical nursing management and hospital administration experience. A goal-directed healthcare administrator who has been successfully involved in various projects, especially the delivery of evidence-based cost-effective quality patient care. Under his leadership in 2019, KFS HD was one of the 6 hospitals and the only facility outside the USA that won the Press Ganey and DQI Nursing Quality Award. Also in 2020, the hospital became the first MOH hospital designated as a magnet. Please welcome with me Dr. to be Mr. Abdullah.
Assalamu alaikum. Good morning. I'm happy to be here and excited to be part of the history in the making for Saudi Nurses Association. Sorry, I cannot stand there. I have to move around. And secondly, I'm very excited about my presentation. Do you know why? Because it's an acknowledgement, it's an appreciation and celebration of frontline staff anywhere they are. These are the pivots of success of care anywhere in the world. And that's why I bring this very little presentation. I acknowledge all our leaders that are here, especially Dr. Muhammad Al-Ghamdi and all the CNOs and our professors and academics here. My presentation has nothing to compare with the presentation that passed me, but it's a presentation of celebration, of people that make the care possible and make it deliverable. So I will start with innovation. I'm just going to present about innovation. Innovation by frontline staff. So I'll start by defining what is innovation. As mentioned, it's a process of turning opportunity into, I think this is covering it. How can we take this off? Yeah, that's it. Into new ideas and putting these into widely used practice. And according to the ICN, innovation is the process of developing new approaches, technologies, and ways of working. For nurses, innovation is about finding new information, preventing disease, better patient care, and better ways of promoting health. So nursing itself is innovation. And for that to be possible, the innovation has to be there first. There has to be creativity that will bring the innovation into life, and more importantly, the right environment, always. No matter what you have, if you don't have the environment, it will never work. And then you have to have the process of innovation. It begins with the involved knowledge, becoming aware of the innovation, and then forming a view about it. Then it goes down to decision is made about whether it should be pursued or not. The innovation is implemented and experimented with, and at the end, a confirmation stage new method become part of daily activity or practice of placing the former approach. That's why we always talk in nursing, evidence-based care, evidence-based care. We shouldn't continue doing what we were doing before. We should do it because it has an essence and there's an evidence behind it. And what my Dr. Turki, very excellent presentations, discuss about magnet, it shakes me because we just went through it. And this innovation was brought about because of the magnet, what we call IFI, Ideas for Improvement. And it was one of the stories we submitted to Magnet, what I'm going to present today. It's about the turning clock. When we hear the turning clock, we'll just be thinking of time. Yes, time is very important and precious. But this time, we're using it to monitor how we turn our patient, where somewhere that is not within the hospital. So what did we do? Our excellent nurses, frontline staff from the home health care of Kemfart Specialist Hospital, design a visual tool for home care, home medicine patients that are not looked after by nurses, but are looked after by caregivers who are not healthcare personnel. It was meant to guide caregivers for the reposition of bedridden patients at home. The whole new transformation of care is taking care out of the hospital. We don't want to keep long-term care patients at home, in the hospital. We want them out of the hospital. But how do we encourage and make sure the quality care is given to them at home? It is aimed at ensuring caregivers' compliance and patient comfort. When we say caregivers, not nurses, not healthcare personnel, just lay caregivers at home. The turning clock is a very simple chart with a very powerful message and presentation. But how did it come about? What triggered the innovation? A patient family had a new housemate who was very new in the kingdom, which is normal. We do bring people to look after our parent. As I've mentioned, she was employed to help look after the sick patient at home and to help the daughter of the patient. As we always also go through, she neither understands English, but has a very, very simple and basic Arabic. And as you know, Dr. Turki mentioned also, a lot of our nurses are expatriate. They can speak the Arabic, but it's not as fluent as it can be understood by people that are lay in the language. So because of this communication error or communication gap, there was poor compliance with patient repositioning and even understanding of the procedure, because patient positioning is something else. You want to know why are you doing it. If you don't know why, you'll never do it. But if you know why, you'll do it. So these subsequently led to increased pressure ulcers, and this poor patient had all bony prominences with ulcer, which is something we're not looking for. Nobody would like that to happen to their family, to their mother or their father or their husband back home. So how was the innovation implemented? Initial data regarding home healthcare patients' data at risk of developing skin breakdown was collected by our able nurses. The turning clock tool was created after many brainstorming meetings and involvement of various stakeholders. It took almost, I think, 3 to 4 weeks with emails back and forth, because between the nurses, a lot of meeting, a lot of, because we have magnet councils in the unit, so the magnet council took over of this and was having a lot of discussion about it. After going through a lot of literature, it was found that in the literature, yes, there is turning clock, but not the one specified to be done at home. There wasn't any at home. So the image on the turning clock poster was carefully detailed to overcome the communication barrier. How do you make a lay person that doesn't know what is positioning, what is the importance of positioning, to do it willingly? So prior to the distribution of the turning clock, pressure entry tool was created to identify if this group of patients has potential or actual risk for injury using the branded risk assessment tool. Then they also assess the knowledge of home caregivers about pressure ulcers and the development of pressure ulcers and prevention. When it was started, nurses collected quarterly data using the pressure injury tool to determine effectiveness of the turning clock. Because without data, nothing is possible. It's like you've not done anything. So you have to take data to gauge what you're doing, where you are and where you want to be. So after all this was what is produced. This is our turning clock. This is a turning clock produced by our able nurses after a lot of brainstorming, after a lot of meetings, after a lot of real hard work. It looks very simple, but you can see from the data I present, it made lots of difference to our patient back home. And this is the tool, data collection tool they produce also. So this is an excellent thing to make a research about, but we're in the process of doing it because this started in 2018. Now we're talking of almost 4 years. What was the impact of turning clock in the prevention of pressure injury at home? We have data analysis from 2018 up to 2021. In a nutshell, we had 26% increase in compliance rate, 4% decrease in pressure injury among home healthcare patients, and 7% increase in pressure injuries cured at home. So this is the data. You can see it from your own, for your own. From only potential and actual, you can see potential in 2018, we have 75% potential, actual 26%, but by 2021, actual only came down to 13%, which is a 12% reduction over years, and it remains steady. And the number of patients involved in this also increased over time to more than 500, from only 76 to more than 500 patients per annum. Same goes with compliance rate. The compliance also increased. And by 2021, we only have 1% non-compliance, so 99% compliance. When it comes to family awareness, it steadily remains at around 100%, except for this year, because we had new families involved in this, so they have to be re-educated and all that. So we have about 3% dip, but this, we're working on it to make sure they're all involved and engaged in it. So as you can see, This is the data for yourself. You can see it all there. The linear has been going through the right way, and the information that we're getting is really encouraging. This is all the work on frontline staff. Same when it comes to pressure injury data so it's been going up and down, but steadily, but has never gone beyond the international benchmarks. And this is also pressure injury data, which is number of healed pressure ulcers, new and old. You can see the linear. It's gone down a bit, but normally when you see the graph, it's going up always. So I'll just use, I think I have time. Yeah, good. When I say we have to celebrate nurses, so how does the innovation demonstrate the impact of nurses? This led to nurses working collectively in identifying needs of our patients and their caregivers. Pre and post implementation of the turning clock indicate an understanding and commitment of all the players, patient, family, caregivers, everyone that was involved in it. And there was early identification of potential skill breakdown and is being managed accordingly. So this project really helped in lessening workload for nurses, decreasing demands on nursing time, interruptions in the workflow, and decreased documentation requirement. It was very cost effective to patient families' financial burden and the hospital as well. So you can see the nurse in the middle, she's the one that recognized that because of a new patient, because of new care, we're having patient pressure also going up. And she started the brainstorming to make sure there is something about it. And those on the left and right side, they're all caregivers also. They are not nurses, they are lay people that were brought in to look after patients. And you can see our patient, and on top of the beds, you can all see the turning clock. This turning clock is very nice chart, excellent chart produced, but this cannot be alone done by nurses, so management was involved, public relations was involved, everyone was involved in developing it. So what do we do to create innovative work environment for nurses? We have to be inclusive. With that inclusiveness, definitely innovation will thrive. So as leaders, we really need to help the workplace by authentic and effective decision making. And this can only be achieved or should be achieved through sharing ideas and listening to others, even if they do not seem to be possible at first. At the end, you see it making sense. And this is all the dynamics of Magnet. Believe me, this is only possible because Magnet were in the journey at that time and we're still in it. And we have to leverage some of the energy within healthcare system to build innovation. And nursing has to look outside of nursing for ideas that may help and may be applied. We have to give time to these heroes of nursing. Magnet journey is an excellent journey, like was mentioned by Dr. Turki, but it needs a lot of resource, a lot of time given to the nurses to be creative. You cannot have Magnet without getting people fully involved and appreciated. Definitely, nursing care is the mother of all innovation, whether we like it or not. And for transformation to be successful, nursing has to be at the core. And Dr. Ilham has proved that, mashallah, with model of care. And we're copying from her. She started with us and then went beyond us. So really, I'll just ask one question. Please, do we all drive here? All of us drive? Apart from the driver, who is the most important in the car? Apart from the driver, we know the driver has to be there for the car to be driven. Who is the other important element in the car? Huh? Huh? The brake and what else? Steering, what else? Huh? What? Petrol, sir? So you can have an excellent driver. You can have an excellent car, no matter what the model is, with excellent seat for your passengers. Can the car just move like that because the driver is sitting there? No. It needs engines, huh? It needs petrol, isn't it? It needs the will to go. So let's have a similitude of the hospital with a car. Let's say this is a hospital compared with a car. You need leadership in hospital to move, isn't it? As a nurse leader, what do you need to be successful? What do we need? We just celebrated them now. We need nurses. Nurses that are involved, engaged, empowered, and appreciated. Just like the car, it's easy to change a driver. It's more expensive to change the engine, the wheels, and the petrol that the car is using. So I'm using this avenue to ask for the Saudi Association of Nurses to please, like the executive director of the ICN said yesterday, it's good to clap for nurses. It's good to say well done. He quoted the princess that's saying, but you have to also show that they are doing it. We want nurses in Saudi Arabia to lead the way, and they will lead the way, and they are leading the way. But first and foremost, are we celebrating them enough in the media? No. We need to celebrate them more. And we need to have something like on social allowance. Nurses are working night, days, weekends, and they're earning the same salary as someone that is working in OPD. Is it fair? It's not. So please, we are soliciting for, and we're asking the nurses, Saudi Nurses Association to help in pushing this forward. Risk allowance, hazard allowance, shifting allowance, on social hours allowance is done everywhere in the world, Dr. Ilham, you know that. We all know that. So please, to encourage people to come into nursing, to augment the pay of nurses, to make it excellent for you to be a nurse, get the media involved, celebrate our success. Nurses were in the forefront of COVID fight, but I'm not seeing it in the media. Make their pocket a bit heavy, and let us be happy and celebrate frontline nurses and nurses anywhere they are in the world. Thank you very much.
Thank you very much, Mr. Abdullah. Very great presentation, linking innovation with the previous Dr. Turki's magnet and the journey. And thank you for the compliment. I don't deserve it. What we have started in E1, alhamdulillah, it was started with everyone, and with the blessing of Makkah, we get ahead. And I think probably, you know, the blessing, this is for all of us, and I don't own it. Alhamdulillah. The other thing, our next colleague and great speaker is Dr. Taqwa Omar. She's well known to all of us. Dr. Taqwa Omar currently is the Associate Executive Director of Nursing, King Abdulaziz Medical City in Jeddah. Dr. Taqwa Omar holds a PhD in nursing from George Mason University, USA, a certificate of quality improvement and outcome management from George Mason University. And also she have a master's in community health from King Abdulaziz University, as well as certification on essential in clinical stimulation across the health profession. Dr. Taqwa presently is the Associate Director for Nursing at King Abdulaziz Medical City in the National Guard, as well as she served 11 years as the Dean of Nursing College, and for 4 years as an Associate Dean for the Nursing College in King Saud Abdulaziz University. She's a member of the National Scientific Board of Nursing, and she is now the chair for the Council of Saudi License Examination at the Saudi Commissioning. She's a member of several committees and boards at the national, regional, and international level. Please welcome with me Dr. Taqwa Omar.
Bismillah ar-Rahman ar-Rahim. Assalamu alaikum wa rahmatullahi wa barakatuh. Good morning, everyone. Before I start, I want to give a big thank and applause to the International Conference Committee for giving me this chance, and to the Saudi Society for Nursing. I'm going to talk about a very important topic, which is building future leadership capacity in nursing. My outline will be, I will give a brief introduction about the concept of leadership in nursing, and the very important Institute of Medicine report, The Future of Nursing, Leading Change and Advancing Health. And then we will discuss why leadership in nursing is important, and the essential nurse leader competency for the future that is a mandate. And then what are the barriers to development of nursing leadership? Leadership is the most influential factor in shaping the organization, and so ensuring the necessary leadership behavior, ensuring the strategies and the qualities that develop is fundamental. Nursing leadership is one of the most important factors in motivating and inspiring nurses in practice at the top of their licensure. So while the definition of leadership in nursing often include qualities such as encouraging, inspirational, and supportive, truly successful nursing leadership must be equipped to evolve as the nursing industry itself experiences ongoing changes and shift with the changes happening in the healthcare. So we all know or read or heard about the Institute of Medicine report, which is called The Future of Nursing, Leading Change and Advancing Health. The key message number 3 of this report stated that nursing should be a full partner with physician and other health professionals in redesigning healthcare. So if we want to be the full partner, we have to be leader. So strong leadership is critical if the vision of transformation or transformed healthcare system is to be realized. So the report also indicated that the nursing profession must produce leaders throughout the system of the healthcare or the healthcare system from and beside the boardroom. So from the bedside to the boardroom, we should have all level of leadership who can be a full partner with other healthcare professionals and be accountable on their own contribution to delivering high quality care while working collaboratively with leaders from other health professions. So also the report indicated that the future of nursing explore how nurses' roles, how their responsibility and education should change significantly to meet the increasing demand for care that will be created by healthcare reform and advanced improvement is in increasingly complex health system. Health system is complex everywhere. So why leadership is important? We know that all nurses must be leader in the design, the implementation, and evaluation of an ongoing reform of the healthcare that will be delivered. So nurses need leadership skill and competency to act as full partner with physician and other health professional in the healthcare system. Nurses who have strongly developed leadership skill are more likely to provide excellent care to their patients. So also leadership skill in nursing are important for furthering all the innovative, all the healthcare changes and all the treatment and care plan and better meeting the needs of the population. So the skills level of the nurse directly affect the level of care for the patient and for the community. As nursing profession improve and more nurses step up to accept responsibility and become involved and innovative leader, patients are met with a better care. So readiness of where nurses are at their career in each level, leadership skill can be used to motivate the team to be more efficient and productive and effective. It doesn't matter where the nurse at which level. She can be a junior staff nurse, but she can have all the quality of the leader. She could be a nurse manager, she could be an educator, she could be an educator in the hospital or in the academia. All of these levels need the leadership quality for the nurses for a better healthcare system and a better care given to the patient and the family. So the nurse leadership skills are important for many reasons. It's important because they encourage good patient care. It is important because they lead to organize the department with a fewer error. They increase the expectation for incoming nursing professional. So it's very important that nurses at all levels have the quality, the competency of leadership. What are the essential nurse leader competency for the future? We know that the need for nursing leadership is a direct response to the complexity of patient care across organization, within the all economic constraint that happening, within all what happening now with the pandemic, and it is needed to promote continuous improvement and patient safety. So there are many essential competency for the future leader, but those are some of the most important competencies needed by the nurse leader in the future. First one is the global perspective of mindset. Second is technology skill, expert decision-making skill rooted in empirical science. And we are going to discuss each one separately. Expert decision-making skill, the ability to create organizational culture and permit quality healthcare, being able to envision the proactively adapt to healthcare system changes and understanding and appropriately intervening in political process, highly developed collaborative and team building skill, and the ability to balance authenticity and performance complexity. The first essential element or competency is a global perspective or mindset. What we mean that having a global perspective or mindset about healthcare and professional issues, nursing issues, healthcare issues, which combine an openness of the awareness of the diversity across culture. Nursing is a diverse field, have people from different background and different culture. And then also it includes developing global mindset, which recognize and bridge the cultural differences is essential to the success of any organization. The benefit of global mindset to nurse leader is that it allows them to proactively identify and respond to the emerging global healthcare and nursing trend, which potentially impact national, regional, or even local healthcare planning. Second competency is working knowledge of technology. Technology is ruling the world now in any aspect of life. So the ability to integrate technology which facilitate mobility and probability of relationship, interaction, and operational process, a very important competency needed by nurse leader in the future. Electronic health record, clinical decision support, and biometric are examples of such technologies that need to be incorporated in the nursing practice. And all of these will continue to impact not only what healthcare data are collected, but how they are used, communicated, stored, and interpreted. Third competency is expert in decision-making skill. Expert decision-making skill rooted in empirical science. So decision-making is one of the criteria of which management expert or expertise is judged. So using systematic scientific approach to problem solving does increase the likelihood of making quality decision. And quality decision usually lead to a better success of the organization. So decision making based on empirical science and research-based and evidence-based practice, best practice also increase the likelihood that decision made will achieve the desired outcome, which is quality and patient safety. So all the decisions made clinically, wisely and skillfully lead to the desired outcome, which we all know is quality and safe patient care. Number 4 is the competency of prioritizing quality and safety. So creating organizational cultures that recognize quality health care and patient, quality health care and patient and worker safety, both of them. We talk always about patient safety, but if we want to balance the healthcare environment, we have to look at the worker safety, the nurses' safety, the other health professional safety, and that need prioritizing and utilization of resource. Applying and embrace the quality technology successfully to improve the quality of healthcare. And this is very important. Technology is in all aspects now of healthcare, from A to Z. We have to prioritize using all of this technology for quality and patient safety. The 5th competency is the coping effectively with change. We know that the healthcare system and healthcare organizations are the more dynamic changing organization. So being visionary and proactive in response to healthcare system, which is characterized by rapid change and chaos, is very important skill and competency that the nurse leader need. So healthcare organization undergoing continual change, and these changes in all aspects of the healthcare organization. It could be in the restructuring, in the quality improvement, and employee retention. All of these need coping with those changes happening in those aspects of healthcare organization. So changes is so rapid that one leader cannot keep with the development. It may be happening, much less be responsible for the innovation needed to keep ahead of them. So we need always to be innovative to keep ahead of them. Such profound change in healthcare organization is not easy, as all major changes bring feeling of achievement and pride, as well as loss and distress. And this is why always we say we need to cope with all of the stress of the work, with all of the burnout. Leaders of nursing specifically need to have a coping strategy and coping mechanism with the changes happening in healthcare. Number 6 is collaborative and team building skill. We know that nurses, leader at all levels, from lower to the higher level to the executive level, they need to work collaboratively, because we are in a diverse interprofessional environment, and we should have that skill. So highly developed collaborative and team building skills are very important for the nurse leader now or in the future. So the paradigm shift with the transition from industrial age, where leadership focused on the hierarchy and management structure. It used to be focused on the skill acquisition, in the competition and control. We move from that age to the relationship age, where leadership focused primarily on the relationship between the leader and follower, on the direction and on the level of the visionary leader, and discerning common purpose and working together cooperatively. Moving to that age need us to have a collaborative skill, to have a team building skill. We have to be an effective, efficient team player within the healthcare team. Number 7 is balancing authenticity and performance expectation. And actually the ability to balance authenticity with performance expectation is a very talented, innovative competency that the nurse leader need. So authentic leader are those who are true to themselves and to their value and to their principles. So this is what we call a congruent leadership, and congruent leadership is defined as matching or congruence between the activity, the action, the deed, and the leader value, principle, and belief. So when we are congruent with ourselves, congruent with our value, congruent with our principle, we are managing our authenticity. So the authentic leadership is the leader principle and their conviction to act accordingly that inspires a follower. And we use that as a shared vision and as a shared leadership. And last and not least is being politically astute. And political doesn't mean only being in the political position. Political skill is how to manage the interaction with others and how to be influential, use influential ways and be innovative in relationship within the organization to accomplish the goal with all what is the change that's happening. So the politically skilled individual or a leader is focused outward toward other, and inward he maintain balance on accountability to other as well as to themselves. So those leaders who are politically astute are very stable because they balance between themselves and the leader. Understanding and being able to appropriately intervene in political process and in relationship is very good skill that needed by the leader. So political skill is the art of using legitimate power wisely, and suggest that it requires clear decision making, it requires assertiveness, accountability, and willingness to express the one's view, and also require being proactive rather than reactive and demand decisiveness. So the being politically astute is very important leadership skill, and it helps the leader to collaboratively work with the team. Any competency, any change environment have a barrier. So there is many barriers in the development of nursing leadership, and those barriers are across the whole level of leadership. So there is multiple barrier, but mainly there is barrier to the nurse leadership development from the beginning. There are barriers to the nurse leadership advancement. While they take the step forward, going to the future, they have some barrier. And barrier to the nurse enhancing leadership roles or enacting, leadership roles, and barrier to the nurse serving on the board, which is executive, higher executive. The barrier to the nurse leadership development from the beginning of the career is time constraint, is lack of available leadership education, is lack of structured nurse leader pathway, and lack of funding. The barrier to the nurse leadership advancement is time, again, one of them, lack of access to working at strategic level, limited organizational opportunity, inflexible in organization, not being seen as a revenue generator, no visibly in the policy making. They are not at the table of the policy. Nurse feel devalued in the system, and time as usual. The barrier to the nurse in acting leadership role, lack of support is always number one. Lack of role clarity. There is no clear role on moving with the job forward up. Large clinical case load, which is again the burnout and the business, lack of clarity of leadership and research role, lack of administrative support, insufficient resources, and again, time. Regulation also sometimes prevent from working or enacting leadership role, and limited resources is one of them. The last thing is barrier to nursing or to nurses serving at the higher level on the board. Of course, still we have negative image of nursing affecting the nurses to be at the table of the policy. lack of enabling structure and processes which exclude nurses from being at the policy-making table, lack of available resources, and lack of involvement within the policy. So with those barriers, there is facilitator. We need to go forward. So as conclusion, adequate number of nurses who have the skill is needed to lead the future healthcare. The growing future nurse leader is long-term goal that all of us require to plan for it from now. The most significant contribution of today's leader can make for the future is to develop their successor, who are the leader of the future. It is very important for all nursing leaders to start now to prepare future leader to have a successor. And it is very important task to achieve the safe and quality care for the patient and for the community in the future. This is a very complex model of what is needed to develop the nurse leader in the future. We need the method, the strategy, we need the approach, we need the theory, the model and framework, but we have a big opportunity to develop leader for the future. Thank you very much. These are my reference, and wishing the International Nursing Conference a success. Thank you very much.
Thank you, Dr. Taqwa. That was really very insightful. Please welcome me to introduce Dr. Sumaya Al-Bulushi. Dr. Sumaya Al-Bulushi is a Director of Nursing Department in the Ministry of Health in United Arab Emirates. She is the Director of Nursing Department in EHS and Head of National Nursing and Midwifery Committee in the UAE, as well leading the Task Force Committee for Cabinet Initiative Attractiveness of Nursing Profession. Dr. Sumaya is an awardee of Emirates Pride Medal for Prince Mohammed bin Rashid government in 2017, as well a Community Service Medal, Best Government Communication Campaign in Promoting Nursing Profession, and Pioneer Nurse at the Global Health Pioneer Award. She is leading Nursing Now campaign at her country and on the national campaign for nursing and midwifery. Welcome, Dr. Sumaya. Her topic will be enhancing capacity in nursing through attractiveness of the nursing profession.
السلام عليكم. السلام عليكم ورحمة الله وبركاته. I'm Dr. Sumaya Al-Bulushi, Director of Nursing in Emirate Health Service Establishment. I'm head of the National Committee for Nursing and Midwifery Affairs at the Ministry of Health level, and also the current president of Emirates Nursing Association. It's my pleasure to be with the Saudi Nursing Association conference today. I would like to take this opportunity to congratulate all Saudi nurses for their great achievement for establishment of Saudi Nursing Association. Also, I would like to raise the hat and thank all the nurses working in Saudi Arabia as well as in the worldwide for their great contribution in COVID pandemic. I'll be talking about enhancing the capacity in nursing through attractiveness of nursing profession. This is the experience of United Arab Emirates. We understand, all of us as a nursing, that capacity building is a process. It's not a single strategy. It's a whole process of developing and strengthening the skills and abilities, processes and resources that organizations or the communities need to survive and adapt for fast changing health world. I'll be talking a little bit about our experience for our initiatives to enhance the nursing profession through cabinet initiatives. Before that, I will give a small introduction about the status of World Report in terms of United Arab Emirates status. We, all of us, understand that health workforce are important, and the most important is how sufficient they are in terms of capacity, capability, as well as quality to meet the epidemiological challenges and changing the demand. And they are important part, all the health workers, specifically the nurses, for population health and to achieve the universal health coverage, as well as for equitable access to health care. We know that the nursing profession status, based on the report of State of World Nursing Report, which was launched in 2020, that 59% of our nursing workforce are within the global health workforce. 50% of nurses contributing among the health workforce. The report rely on three major and important pillars, which are the education, jobs, and leadership. And this is a great opportunity for all the governments to invest in those three pillars. 8%, they found that 8%, there is 8% only annual increase in nursing graduates all over the world. Coming back specifically to United Arab Emirates, we are 5.9 nurses per 1,000 population based on 2020 report. Nurses compose 47% of the health workforce in United Arab Emirates. Within the organization that I'm working, Emirates Health Services, the Emiratization rate is 9%. So this percentage is not at the country level, but it's only at the Emirates Health Service level. We are proud that the bachelor degree is considered as an entry to the profession since 2014. There was a great framework for our enhancing the capacity in nursing started in 2014 through enhancing the attractiveness of nursing profession as a major initiative from the cabinet. And that was from 2014 till 2021. We had a national strategy for nursing midwifery affairs. We have also joined Nursing Now campaign. We did some changes at the country level for the professional qualification requirement. We had a great staffing model that was achieved in 2017. We launched also our Emirati nursing model of care, and we had many nursing specialties program launched in the country. We have a great academic collaboration. All those, we consider this as a framework, and this actually led us to be successful in leading or managing the pandemic response as well as nurses' well-being. Coming to the first pillar that we work toward enhancing the attractiveness of nursing profession, which I made, this initiative has been started brainstorming at the country level by 2013. And the retreat happened where a vision of nations' priorities started. And then we launched these national initiatives to promote the nursing profession and enhance Emiratization. The initiative rely on three major pillars: media, motivation, and education. Many activities, of course, under each domain has been progressed. The official launch for this initiative, it was in 2015. A lot of work have been happened, a lot of activities have been done in terms of brainstorming, teamwork. We rely on best practices, benchmarking, and it was benchmarked also in partnership, and we had financial planning and analysis. We were able to have the first award at the GCC level in terms of the best campaign activities for the nursing promotion at the United Arab Emirates. Also, we had a film that's launched at the national level, and this film was awarded in Cannes Festival, actually. And the activities are still continued till 2021. One of those important activities, we noticed that the number of bachelor students have been kept on increasing. Right now, we have around 2,000 Emirati nurses studying from year 1 to year 4, which consider as a great achievement for our country. Our number of nurses and master students and specialization kept on increasing per year. We launched a Salma Innovation Award at the country level. We also launched Nurse-Friendly Hospital Award to encourage all hospitals to work their own activity to promote on nursing activities. After launching and after we worked for the last 5 years on enhancing the attractiveness of nursing profession, we came up with a lot of challenges that have been raised at the national level, which made up to work again at the government level to launch the National Strategy for Nursing and Midwifery Affairs. The strategies was the vision of this strategy actually, we consider nurses and midwives as part of the multidisciplinary healthcare team will lead world-class healthcare and contribute to improve health outcomes and well-being of United Arab Emirates social to accelerate the progress toward 2071 Centennial Universal Health Coverage and Sustainable Developmental Goals. The values of those strategies like caring relevance, leadership, ethical partnerships, social responsibility, responsiveness, and innovations. The strategy itself has 5 major pillars, which is effective regulation, governance, and leadership. We have sustainable nursing and midwifery workforce management, quality, innovation, education, and professional development, transformation, practice, service, and quality care, advanced research, evidence-based practice responsive to national health priorities. Under some of those pillars, we have been started working since 2021, the beginning. We had launched, we started working and unifying the national. There is a national working group to unify the scope of nurses and midwife at the country level. We also have a national brainstorming workshop to establish the nursing and midwifery research mentorship program. We also working and going to launch in the coming few months soon in collaboration with Ministry of Education, the UAE competency framework for bachelor degree in the country. We also joined the Nursing Now campaign, and that was in 2019. We were proud of, and we had a lot of activities under that campaign. We also work and raised to the government accelerator that we need to change some of the professional qualification requirement, and that was related to our new graduates and the immediate recruitment of those graduates. We launched our staffing model, and we have been awarded within a Stevie Award in the region for the best staffing model. We also launched an Emirati nursing model of care. We would like to show how, what are the values and the concepts of Emirati nursing care. We further went and worked a lot on nursing specialization programs like clinical resource nurses. We have created those new titles within Emirate Health Services. And also we had put a lot of efforts on informatics nurse because of the important emerging health digitalization, as all of you know. In terms of nursing specialization, we worked a lot with our partners, with our main stakeholders in order to be able and to talk a lot about capacity building. As I told you, it's a process, not one of the strategies. We were able to have a great academic collaboration with the universities, with all the local universities, and we tried to expand all the private university and enhance the capacity of those universities to accept more graduate within those universities. We are part of advisory committees. We have midwifery academic path also. We have postgraduate nursing specialization program within those universities. And those are the type of specialty have been started for the last 2 to 3 years in the countries, and we are going to do more in the coming years. All of those strategies that you have seen, the whole framework added and helped us actually to enhance the capacity, and then which it was one of the reasons that helped us actually to be able to respond very well to pandemic and also this and nurses' well-being. We started doing the surge plan. We have the recruitment prior to graduation. We were able to collaborate with Ministry of Education and the universities. For the 4th year student, nursing students, we asked them to do the intensive training during the COVID. So we took them as an employee and started their intensive training and onboarding in order to consider this period as their graduation. And we were successfully officially recruited all the graduates at that time, which was in the mid of 2020. We worked on a lot of strategy to encourage our frontline supporters and work toward their well-being. We also started to work on continuing business in the country, not to stop all the continuing service, continuing businesses. So we started on nursing education e-clinic, where nurses were able to communicate with the patient. Many services have been like maternity, diabetic care through the e-clinic because of the massive lockdown that happened in the initial, at the beginning of pandemic. We also took COVID as an opportunity and did a lot of strategy that help and empower our nurses. And one of them was nurses-led mass vaccination program. And it was hugely successful. And all of you know that the country considered one of the best and the first ranked who covered the majority of the population with the vaccination. 90% of the population are vaccinated. Pandemic response and nurses' well-being was one of the important also processes in terms of enhancing the capacity of our nurses, because we worked a lot on their mental well-being, especially in the beginning of COVID, and that ended up with one of the innovation that we did, which is WeCare application. This is one of the smart application that we work toward making the nurses to communicate with each other, to understand the health and their mental health also during pandemic. And we will continue taking care of nurses' well-being because it is one of the strategy that made our nurses to be very operative during the pandemic. We also worked at sharing experiences at international level, and we were glad and pleasure to have all our international speakers to show them and expose, to understand their experience as well as to show the country experience to them. This is the end of my presentation, and I would like really to thank you all for the listening. Thanks for the Saudi Nursing Association. It was a pleasure to be part of this conference. Thank you very much.
Thank you very much, Dr. Sumaya. And we come to our ending for the morning session. We'll open the discussion if anybody have any question. Any questions?
Thank you for this informative conference. I have only clarification. Dr. Taqwa, Dr. Sumaya, and Dr. Turki tackle this topic related to nurses burnout. With COVID and pandemic, there is shortage of staff. The turnover is very high. The nurses are leaving. They are not going for vacation. As outcome, the burnout increase. Other than thank you letter, as leader, how to improve or decrease the burnout with the staff? Thank you. Yes, Dr. Turki.
Dr. Turki will answer this. Thank you,
Or
Doctor.
Dr. Turki or Dr. Sumaya, she mentioned something related to application, care application. If she can share with us this application and how to.
Thank you for your question. You pointed the pen out with the nursing through the pandemic. I showed a while ago in my presentation a recent statistics from MOH statistical book, which is yearly referencing books that every healthcare worker referring to. We usually link burnout to the turnover. And if you look at the recent 2 years, we don't have actually the average of increase of nursing recruitment here in Saudi Arabia, yearly increasing by 5,000 nurses. That's in numbers. However, in the last 2 years, we are decreasing by 4,000. So we are not in the same rhythm like every year since 2016. So linking this, for me, as an example, at PSMMC, I'm not yet still convinced of shortage, honestly, at PSMMC. But I'm convinced of burnout. Why? Because we implement methods of magnets, and we look at the direct nursing care. And if you look at your statistics in your hospital, look at the direct nursing care, because this is where you feel the shortage. You don't feel the shortage in a management level. You don't feel the shortage in an ancillary staff. However, you will feel the shortage only in the direct care nursing. So if you look at your direct care nursing, you may be surprised.
That's what I'm looking for.
Yeah. So, yeah. However, for burnout, in hospital like Prince Sultan Military Medical City, we looked at resources, how to let the staff feel satisfied and to omit the burnout within the staff. We use the support of OBDs usually and the educations, and we get our surge. So we're not yet into the burnout. We ask average overtime for one staff, for example, 32 hours, means like maybe 2 shifts. And usually the turnover, if you are within 20%, they call it manageable shortage. In each individual units, if you have 20% turnover, it's manageable, because it can be managed by your resources and hospital. However, if it's exceed 20, you will see the burnout. You will see the staff will feel actually inadequate staffing in your units. However, if the turnover is below 20 and the staff feel burnout, we think that a detailed investigation need to go through this unit, because staff actually are not working as a team. They're not having a teamwork, an individual unit. I hope I answered some question, because we go in details in this.
Thank you, Dr. Turki. Last questions, because of the time, we can take 2. Yeah, go ahead.
It's not a question, it's a comment. Okay, you know what? My comment is cancelled. My ladies comes first.
Assalamu alaikum.
Wa alaikum salam.
My question is to Dr. Salma, if she will be answering my question.
Doctora, are you online with us? Yes, yeah.
She's available.
Doctora Sumaya?
Dr. Sumaya, she's available.
Yes, I'm available.
Yeah.
Assalamu alaikum, Dr. Sumaya. Thank you so much for your informative lecture about, you mentioned a lot of things related to the sustainable development goals. And as you know, from September 2015, 193 countries, the worldwide leaders, they agreed on 17 sustainable development goals. And today you mentioned about these goals in your presentation. Please, can you elaborate in the importance of nursing implemented and adopted these goals? Especially we are talking about the new horizon for Saudi nurse profession, and we need to be part of the world at the level of national and global level to reach to the international to the international Yes, to reach to matching with matching the trends with regard to the Vision 2030 and with regard to the trends related to the Sustainable Goal development and implemented in the national and global level. Please elaborate in this, please.
Thank you a lot for your question. As I mentioned, all our strategy always they have a vision and mission, same like yours. And the aim of all health workforce is usually for the universal health coverage, access to care, as well as to be achieving the sustainable developmental goal. Now we know as Ministry of Health in all countries, there are direct goals that we are linked with, and there are indirect effort, of course, for the other ministries to go with those sustainable developmental goals. But as nursing, we have to show always the visibility and the important being 50% of the health workforce that we are working toward achieving those. Now, how we do achieve this? Of course, there are many, many, many direct strategies. And goal number 3 is related directly to the health. So that's part of our role being. So when you put our strategies, we always put that as a vision for us because we want to maintain this for the whole country. And I think if you go back to the strategy and check the activities under each, maybe that will give you more view because it really need a lot of elaboration. It will not be answered by 1 or 2 sentences, but that's the general aim. Thank you very much.
Thank you.
Thank you very much. And we're coming to our break, the morning break. See, huh? Answer. Yeah, but we don't have anybody to give. Doctor. Yes. Sorry. Actually, يلا دكتور تركي. وبعدين في عندنا مستر عبد الله نقالة. يا دكتورة فاطمة. دكتورة سمية. and دكتور تركي المدير. I told Mr. Abdullah twice and 3 times. Okay. دكتورة تقوى عمر. And we said Dr. Sumaya again. Thank you.
The anesthesia.
My name is Ariel, and I
I was eating because I was stressed out.
Hello. We're going to start. Hello, attention, attention. Dr. Fahima, how are you doing? The good thing is we have a representative across the kingdom. Huh? Amazing. Where is everybody? Because I need to make an announcement in relation to the workshops. I think there is still 3 workshops that have slots, if anybody interested. The workshop 1 is full. And you know why? Actually, it's over the capacity. We're gonna announce the venues. I think that one will be here, somewhere here. We're gonna take it. Others are upstairs. Session empowering Dr. Ilham also is full. We have slots for magnet, workshop number 2, workshop number 3, tools and strategies for quality improvement. And finally, workshop number 4, health workers practice. So anyway, we'll give you more details, the venues. Is Miss Teresa with us? She's on, Teresa? I know she's video. Good.
Yes, I'm here.
Thank you, Teresa. Thank you so much. Ms. Teresa Bisan, colleague of mine that we work together. She is the Executive Director of Nursing Operation, Ministry of Defense Health Services in Riyadh. She is a senior nurse executive with over 7 years of experience in the Kingdom of Saudi Arabia in both the private and governmental sector. Currently employed by the Ministry of Defense Health Services, the Executive Director of Nursing Operation, with oversight of 23 tertiary military healthcare facility and primary healthcare. She is a member of SNA, an active member of its Professional Development Subcommittee, short courses. She is a co-author in the SBSCC Saudi Patient Safety 2021 publication, Nurse/Midwife to Patient Ratio, and Sabahi Committee, member of the 4th edition. I would like to welcome Teresa, even though she is with us, she video recorded, and we can start her topic, which is, I believe, everybody is interested to hear, and that is a civility. Very important. She has a great compassion about this topic, and she's going to enlighten us about the culture of civility in nursing. Thank you.
Good morning, everyone. My name is Teresa Beeson, and the topic of my presentation is the culture of civility in nursing. Before I begin, I would like to express gratitude to the Saudi Nurses Association for the opportunity to speak and present at the first SNA conference. And in the interest of time, I'm going to move through my slides pretty quickly. The agenda and topics that I'm going to cover are on your screen, but I want to share some of the aspirations that I have for this presentation. I am hopeful that at the end of the presentation that the attendees will be open to the option of using the terminology civility and incivility within their organizations if they're not already doing so. And secondly, I'm hopeful that it's going to be very clear that civility is a strategic priority for all of our organizations. Civility touches every KPI, every project, and every initiative that we have set out for ourselves. I'm actually going to start at the end. Any program for civility has several end goals, and those are to prevent incivility and to reduce incivility. And we want to do this at the lowest level possible. And when we talk about the lowest level, this is the unit level, the individual level, the level of the nurse providing direct patient care. We want to find solutions as soon as possible and as early as possible to the satisfaction of both parties. And by both parties, we mean the alleged victim and the alleged abuser, and with no retaliation. This process is very long. It requires staff awareness and training, and that everyone is engaged and committed to prevent incivility. We need to have the staff confident, first confident in themselves and their ability to address it informally, and also confidence in their leaders that when they report it, it can be addressed effectively. Resolution can be either informal or formal, but both options and paths should be available to the staff at all times, and there should be no retaliation. The definition of civility is very simple. It's being polite, displaying genuine courtesy, showing respect, being professional, and demonstrating professionalism. When we talk about unacceptable behavior in the workplace, there's lots of definitions we've used for many years, and they're on your screen. I'm not going to read them, but I want you to focus on the bolded red words. And when we introduce the term incivility to the words that we've been using for decades, we need to know, where does incivility stand in the lineup with them? The definition of incivility, which just popped up on the lower part of the screen, is low intensity deviant behavior. It can be as simple as being rude or discourteous, with or without the intent to harm the individual target. It's important to note that incivility is a violation of workplace norms of mutual respect. It's also a violation of the code of conduct for nurses, and the code of ethics for nurses. You might notice that the definition of incivility has no red bolded words, and that is by design. Incivility is, you can consider it the lowest rung on the ladder of unacceptable behavior. And what we want to do is to be able to deal with it as early as possible before it becomes any of those red bolded words, such as hostile, aggressive, or harmful behavior, before it causes humiliation, or before there's threats, taunts, and intimidation. Additionally, you can see that incivility may be a single event. This is oftentimes controversial. In terms of how it relates to bullying, bullying is by definition repeated behavior. This is significant for a very important reason, because oftentimes when nurses or employees have the courage to report incivility or uncivil behavior, especially if it's a one-time event, they will be asked to disregard it. They will say, someone will say to the person, it's a one-off, it only happened once, just let it go. So to be clear, the evidence in the literature is supporting that we deal with the lowest level of behavior as early as possible, and we should be dealing with single events. It's clear that if an initial minor incident, a single event, which we can refer to here, such as incivility, could be mitigated, then the financial and the human capital that could be realized by the healthcare organization is immense. We know that globally, workplace violence annually costs $4.2 billion US and over 1,000 healthcare workers' lives. To further the argument to use civility and incivility as terminology, we want to consider civility as the foundation of our practice and our organizational culture. It is a positive aspect of our work. Once we have defined civility, and once we have modeled it and we have emulated it and we've promoted it, then we can go to the second tier. The second tier is incivility, and we can then decide and define what is incivility, what do we not want to see in our workplace, and how are we going to effectively address it. Once we do that, then of course, there will still be the terms and the definition and the behavior sometimes of bullying, abuse, and harassment and violence in the workplace, but it's going to take up a much smaller space in our workspace. So if we choose not to use civility and incivility, we're left with the old words. And if we use the old words and we're actually using their definitions as they are intended, we have to acknowledge that we are very far on the other end of the spectrum of behavior. And this is very entrenched, and it's actually going to be much harder to address it and undo it. So regardless the name that it's given in your organization right now, incivility is a reality for almost all nurses. It is the core of an unhealthy and an unsafe work environment. I'm going to stop here for a second. If it is the core of an unhealthy and an unsafe work environment, then it must be addressed. And it's best to be addressed in a systematic and a very structural way. Incivility's negative impact reverberates throughout the organization, and incivility is endemic within the nursing profession. No country, no hospital, no department, no unit is exempt from it. When we look at what incivility looks like for nursing, I'm not going to read this in the interest of time. I'm only going to highlight some of the very more, I guess, unknown ones, or the ones that are most conversational when I do this lecture in the past. And so the most important thing is that any of these behaviors can either be overtly or covertly displayed. We want to look at incivility in terms of the iceberg analogy. Now, there are things we can see and things that we don't see very easily. And at the top, we see aggressive communication or shouting. And for nursing, our default example of incivility is typically the physician at the nurse's station shouting at a nurse. And I'm not saying that, I'm not trying to minimize that. It is wrong and it should be addressed. But we go to this example almost by default because it's the one that we see. And it's the one that has witnesses. And it's sometimes the more easier one to deal with. But we have to acknowledge that there is this under part of the iceberg and all of this behavior that we don't see, or it's more difficult to see. And this is really a manipulation of work and isolation. And it is more nurse to nurse than any of the other ones. And when it happens in patient care areas, it's more concerning. So this is the unfair assignments, the sabotage, withholding information, and avoidance. Incivility occurs on a continuum. And in the research, this is referred to as the insult to injury spectrum. And on the one side, you have civility, and on the other, you have actual physical harm. And what occurs is that when we don't have a strong culture of civility within an organization, that low-risk behaviors become rooted, and people try them. And this can be eye-rolling, snide comments, an occasional unfair assignment, other things that are happening. And if we don't address the low-risk behaviors, then they become high-risk behaviors. And if we don't address the high-risk behaviors, they can potentially become physical harm or physical abuse. So to be very clear here, no abusers ever start off with threats or abuse. What they do is they attempt low-risk behaviors, and they may attempt them for months or years, and they're literally watching and waiting to see who, or if anyone, will leave this behavior unchecked, and then it always will escalate. So incivility occurs on a continuum. It follows a natural progression beginning with low-risk behaviors that always develop into high-risk behaviors if left unaddressed. Incivility or unacceptable behaviors never go away on their own, and they are always repeated. They always escalate if we leave them unchecked. I'm not going to spend too much time on the statistics, but I'm going to give you a few. And so the first one is nurse-to-nurse incivility is the most common at 64%. This means that the most common incivility in an organization is not the physician to nurse. It occurs, but typically nurse-to-nurse incivility is the most common, and it's under the iceberg incivility. We know that 78% of new nurses reported either being bullied or experiencing incivility in the previous month. And nurses experience incivility weekly and daily at rates that are too high for comfort level. These are probably published studies out of North America. There has been studies published in the Middle East and within the kingdom. There was one in 2002. It's a little bit dated, but I'm still going to present the results. But 54% of nurses reported workplace violence or incivility. 92% reported insulting language, and 16% reported actual physical assault. So when we look at no matter what country it's coming at, all of them are staying in the same area between 50, 60, 70% of civility happening. And I'm going to jump around a little bit. On the next slide, I'm going to jump into what are some of the key elements to a framework for civility. And one of them is having baseline and ongoing data. The percentages that I just showed you are interesting, but we always feel that when it's our organization, that it resonates more or it's more illuminating, which is very true. And so we know from a quality perspective, whatever we want to improve, we cannot improve until we measure. And so I just put two studies on the screen, and they're both by the same author group. And they published in 2017. And the first one was a lateral violence in nursing survey, which is a valid and reliable tool. And then they retweaked it a little bit in 2019 and republished it under a different title called Negative Behaviors in Healthcare. So you can see how we're moving away from lateral violence to other terms. And negative behaviors is very similar to incivility. Now, the authors are very approachable, and they do allow for replication, of course, of the survey and are supportive of modifications for geographical or cultural considerations. But I just want to give you an example of some of the questions that can be measured annually in an organization. So the first question of the survey is, how often are you treated with courtesy and respect by coworkers? This is measuring the positive. This is measuring that civility foundation. And so instead of going negative to begin with, we want to measure how positive are we as an organization. Another question asks, how safe from retaliation would you feel reporting an episode of lateral violence? Now, just imagine for a second that if you have the ED department or the critical care department stating that they only feel safe 25% of the time to report lateral violence, and they fear retaliation significantly, while a medical surgical division reports that they feel safe 80% of the time. This is more actionable data, excuse me. This is more actionable data and more useful data. When we look at the next question, how often have you crossed the line and used behaviors that would be interpreted as lateral violence or incivility to a coworker? This is self-reflection and insight. There's no possible way that 90% of nurses can experience incivility, and myself included, that we are not perpetrators at some point in time. And finally, have you received any special training on techniques for dealing with rude or discourteous or uncivil individuals, and has it been effective? This will allow us to put interventions in place and measure them to see if it's effective. So if we go back to this insult to injury spectrum just for a second and reinsert the ASHRAE data, what we have is very high 92% harsh insulting language that possibly hasn't been addressed, and it escalates through with 38% of the nurses reporting verbal threats and 16% reporting actual physical assault. Now, what I'm presenting next is completely fictitious data. What I'm suggesting is that if we can measure civility and incivility and we put in place interventions, what happens is that we could see and we could quantify the civility or incivility and know if the interventions we're putting in place are effective. And we would hopefully see a reduction possibly to 60% in harsh insulting language. And then also you can see that we would expect the corresponding decrease in verbal threats and also physical assaults. So if we go back to the iceberg analogy very quickly, I'm just going to replace problems with incivility. And what this is going to state to us is that only 4% of the top managers of a hospital understand the incivility that's happening in the organization. And if you look at the bottom corner, we know that 100% of incivility is known by the frontline workers. This is the nurses providing direct care on the units.
Recording in progress.
In incivility, there are three main players. And everybody falls into these categories at different points in time, but we're all in these categories. And the categories are the instigator, the target or the victim, and third and final is the observer. And they're typically the silent bystander. In terms of the abuser or the instigator, there are certain traits that emerge. Abusers often feel that they are above the rules and regulation. They are typically seniors who feel protected and they have no insight into their behavior. Often these individuals are seen as excellent or this or that. And this is very key that this is actually published in the literature, because I don't think there's a nurse leader in this auditorium who hasn't experienced someone that they thought was an exemplary employee, someone that they trusted, that they went to only find out years later that they were perpetrators. And it makes us question our ability to understand people and judge people. We always want to enable the victims because this establishes or actually reestablishes a sense of personal and professional integrity. I think I'm at the 4-minute mark, so I need to move through some slides quickly. Most importantly from this slide, and the research is showing this recently, that we have to activate the bystander. This person is key and critical. If this person can advocate for the victim when the victim cannot, this is the game changer to the environment, especially in the off shifts. So we know that 90% of nurses will be bullied at some point of their career. And for the interest of time, we know that there are very many negative effects to the organization and to the nurse for their physical and emotional well-being, and especially to turnover of nurses. We know that 100% of the patients are at risk. Nurses dealing with the effects of an uncivil work environment are less likely to respond fully to the needs of their patients. And very importantly, they are less likely to speak up if there are safety concerns. This is from 2019, which is a very significant publication. There are some reoccurring themes in nursing, specifically to incivility. And one is that the behaviors are minimized or not recognized. What this is a lack of awareness. There are no clear expectations for civility and incivility. There are very many silent bystanders, and everyone is left, specifically the victim, to know, is anyone going to intervene for me when I cannot intervene for myself? The other is the fear of retaliation. We have to acknowledge that in the kingdom, with annual recontracting of a multinational workforce, that many of the nurses will simply make the strategic decision to remain silent and to not speak up and to finish their contract and leave. Because if we cannot fix it, it will be worse for them. And so they're making that judgment call. It's better for me not to say anything. Ultimately, it's organizational chaos, as described on the other slides previously, and we have many negative outcomes, most importantly, the continuation of the nursing shortage. It's imperative for nursing to acknowledge that this is in our house and this is affecting our shortage, specifically in the kingdom. Incivility is a slow death of the nursing profession. I have to move something very quickly. Okay, so in terms of incivility, it is a violation of the Code of Ethics for nurses. Nurses are to practice with compassion and respect for the inherent dignity and the worth and the unique attributes of all people, and all people includes our colleagues. This is a definition of incivility, which I didn't share at the beginning, which is interesting. Incivility includes failing to act when action is warranted, failing to speak up when indicated, and refusing to assist or support a coworker, even when related to incivility. And in terms of creating a program for incivility, I'm in the interest of time, I'm going to highlight number 3, which is to make civility a strategic priority with measurable KPIs and outline structures and processes for it. In terms of what a culture of civility program could look like, first, we start with baseline data, and we already discussed what that might look like. There has to be awareness and to set expectations, and this should happen on hiring and ongoing. And this is where the kingdom has a built-in mechanism, is that we can introduce this at annual recontracting. Staff empowerment and support. There are many tools, which I don't have time to go into, such things as Crucial Conversations, STOP, DESC. These are tools and acronyms that allow nurses to feel empowered to address incivility. And of course, there has to be structures and processes to support both the informal and the formal resolution of incivility. Number 5 is very important. Leaders cannot be the perpetrators. The nurse leaders must be able to support and model civility, and they need to be viewed by their staff as competent to be able to address it. It will never be reported if they don't think or know that their managers or their leaders can resolve it. And in terms of incident reporting, it should be robust, transparent, and a trusted investigation process. And then ongoing data and trending can occur. And I don't have time, but Robert Wood Johnson has an excellent index called the Civility Index Dashboard, which allows you to understand civility and incivility hotspots within your hospital with data that's typically already collected. So what do we want? We want the staff to know how to react. We want them to be and remain confident, to be professional and civil. We want them to confront the person and the situation. We want them to report the behavior and to advocate peer-to-peer, which is to not be a silent bystander. So this is my last slide. Basically, incivility is allowed to occur for two reasons. One, because it is modeled, and because it is left unchecked. And that is the conclusion of my presentation. Thank you very much.
Thank you very much, Teresa. Stay there. At the end of the sessions, we will have question and answers.
We'll
Indeed,
stay on.
very
Thank you.
important topic, working health environment. We will talk about it later on.
Perfect.
We have a lot to say.
Okay. Thank you.
Next speaker, Ms. Abrar Bershed. She is a director of decision support and data analytics in Dammam. I know her very well. And the topic she's talking are very important. Growing within nursing, right? I'm not going to share with you, but you guys going to ask, what does this mean? So Abrar has over 8 years of combined experience in healthcare quality, management, and patient safety. She earned a baccalaureate degree in health information management and technology from Imam Abdurrahman bin Faisal University and master's degree in business administration from Prince Mohammed bin Salman College for Business and Entrepreneurship. Additionally, she earned a diploma in safety, quality informatics, and leadership from Harvard Medical School. While serving as a nursing quality and patient safety director of KFSHD, she also oversees a network of over 100 primary care clinics and 20 hospitals, helping to bring about the nursing excellence and national health transformation Vision 2030 goals for that region. Please join me to welcome Ms. Abrar.
Assalamu alaikum jami'an. Thank you, Dr. Abdul Ghani. Thank you to the scientific and organizing committees. I'm very grateful for being given the chance to be speaking at the first International Nursing Conference for the Saudi Nursing Association. So as the curtains open, it's a new opening in my career life. Today, I'm very excited and happy to share with you my story as a nurse growing with nurses. I would like to start with my background. I'm a proud health information management and technology specialist with experience working in various hospital quality departments as data management and quality improvement specialist. You cannot believe it. It took me 5 years to make a brave decision joining nursing while I'm not a nurse. There should be something very convincing for someone to leave his professional track and join different track. I had to face many comments. You're not a nurse. Why? How? You're not gonna progress in your career? But I had to ignore all these comments and join nursing. So what influenced me to work in nursing? So from my experience working in quality management, I came into a conclusion. Majority of quality improvement projects initiated by our nurses, the most successful ones was led by nurses. It's a fact. Almost 80% of reported OVRs were from nurses. If the hospital want to succeed in any initiatives, if they want high response in surveys, it has to go through nursing. So this shows their commitment, dedication to quality and patient safety, and this is my passion. That's why I wanted to be part of the change, not just documenting it. This statement was made by my role model, the person who convinced me to join nursing. I will never forget this statement. It initiated me into nursing. So while I was joining nursing, I even didn't know what will be coming on my way that will even make me stronger in my field. I work with nursing. All of a sudden, COVID-19 happened. So nurses, they were good at their clinical side, but they appreciated my side that I'm used to it. As you are all aware that Eastern region was the first hit by Corona. So we were facing staffing crisis in critical care areas. So we worked with the nursing leadership team in the cluster to ensure safe staffing levels are always maintained during the pandemic. We created a dynamic daily dashboard that shows at a glance the staffing level in all our various facilities. So as you can see, at a glance, you will see if it is dark green, means they are well staffed, so we can move and float those nurses to other areas to support patient care. So if it's in red, then they are in a severe shortage and need for staffing. And by that, we will ensure the safety of our patients and the delivery of high quality of care. While ensuring patient safety, as Dr. Abdullah mentioned, we shouldn't forget our nurses and our staff. So this has come with a lot of stress and anxiety. So we worked in developing Assist Me program that will give emotional support for second victims and burned out staff who are going into ongoing challenges and difficulties. I was part and pioneer of those team who initiated this program at King Fahd Specialist Hospital, and this is a picture of the team who created the program. One of the greatest things ever happened to me was my involvement in Magnet Journey. I was very delighted to be in the history of working in one of the first Ministry of Health hospital who were recognized as a Magnet hospital. As you know, Magnet requires a lot of data-driven documents and activities. And because we were efficient in our data entry and were excellent in our KPIs, in 2019, we were awarded the NDNQI Award for Outstanding Nursing Quality. In 2019, we got the award. 2020, we were recognized as a Magnet facility. It's ongoing success, achievement, and progress. I cannot believe it. I just came at the right time with the right people and right mindset. I met exceptional nurse leaders. One of them, she's sitting with us She was my barrier joining nursing. She helped in the development of many people. She gave me the exposure, and this will emphasize on what I said, the things that I learned from my experience working in nursing, I will never be able to learn if I was just in support departments. So do not be in the periphery, just work and always be in the core business. My professional development, for any professional development to thrive, it needs environment that supports your career progress. And what do you think? Which environment is that? Nursing. In 2 years, I was able to complete my 1-year certificate from Harvard Medical School while doing my MBA degree. And I'm very proud of my achievement, and I'm very grateful for the profession of nursing. So at a glance, I would like you to look at my career progression and compare by yourself. So the first 2 experiences was me working in non-nursing department for almost 5 years. And since I joined nursing as a senior quality data analyst, I grew to be director for nursing quality and patient safety, leading nursing quality at the cluster level, and leading decision support and data analytics function at the whole cluster. Those are the beautiful people, the people I work with. I will never forget. They are the one who made me to whom I am today. To cut the story short, if a non-nurse can achieve this height, how about you nurses? For you, the sky is not the limit, it's the starting point. Thank you, nurses.
Thank you, brother. Always short and sweet. Our next speaker, Dr. Kathy Ann Cinco. She has 31 years international healthcare experience, gained in public and private sector nursing and healthcare experience in clinical, operational, and strategic roles across all healthcare sectors. She also spent almost a decade working in leadership position in Fortune 500 and FTSE 100 companies. one of the top in London, Europe, including Cerner Corporation and British Telecom. She has been staff nurse, head nurse, CNS, direct. When I hear those things, makes me, this is the way to grow. Director and was adjunct faculty at the City University London and New Buckinghamshire University. Dr. Kathy was one of the first nurse consultants to be appointed in the UK and Smith and Nephew Research Scholar and a Department of Health Mary C. Cole Leadership Scholar. In 2001, she was honored by Her Majesty Royal Highness Queen Elizabeth with the Order of the British Empire, OPE, for her contribution to UK healthcare. In 2008, she was appointed as a public appointments ambassador for the UK Government Equalities Office. Dr. Kathy gained her BSN honors in nursing from King's College London, master's degree from University of Southampton, UK, and doctorate at Middlesex University, UK. She is fellow of the Institute of Leadership and Management, member of the Royal College of Nursing and the European Mentoring and Coaching Council, and is qualified to administer and interpret the Myers-Briggs type inventory. Dr. Cinco is respected the thought leader and conference speaker on topics including APN, patient experience, healthcare leadership, and maximizing the nursing and midwifery contribution to national global healthcare points. Dr. Kathy is here with us today to talk about something old, something new, the nursing roadmap for delivering Vision 2030. Welcome, Dr. Kathy.
Good morning. Good morning, everyone.
Good morning.
My name is Dr. Kathy Shenko, and I'm the Executive Director for Nursing Affairs at King Faisal Specialist Hospital and Research Center in Jeddah. I'd like to take this opportunity to welcome you to what is a very auspicious occasion, the very first conference of the Saudi Nursing Association. And I want to congratulate Dr. Mohammed Al-Ghamdi and the organizing committee and the scientific committee for having the vision and the foresight to put this event on. I think that 2030 provides us with both a challenge and an ambitious opportunity to focus on how nursing supports and helps the delivery of Vision 2030. And I believe that for us to get there, we would need to focus on our fundamentals, but we would also need to approach it with a sense of vision and a sense of newness and excitement that would help us to deliver a vision that is not just for nursing at a hospital level or at a local level, but at a national level and an international level as well. So I'm going to start by focusing on our current reality. Where are we today? And then I'm going to look at Vision 2030 and what that means in terms of the health sector transformation plan. Of course, we need to consider what the implications are for nursing, and then think about how our nursing fundamentals have anchored us into a place where we're on a solid footing for taking a new step or additional steps into this brave new world. And then I'm going to speak about how we actually get to where we should get to and can get to in terms of nursing delivery of Vision 2030. So what is our current reality? Our current reality, which many of you will be experiencing right now, is that we are still in the middle of a global pandemic. And within that, we have approximately 600 nurses short across the world. And there is a predicted need for something like 13 million nurses and midwives by 2021. So that's a huge challenge to us, as well as just the operational challenges that we have today of being able to staff our wards safely or units safely, being able to provide the care that what patients need, maintaining quality, and dealing with some of the big challenges in organizations, like access to healthcare, like bed turnover, like cost and efficiency. We know as well that there's about 17% of the nursing workforce globally is planning to retire within the coming decade, and that is just what we know about today. And in the face of all of that, we're dealing with just the most significant burnout. I was at the Magnet conference recently, and burnout was just one of the key topics in terms of how do we prevent it, how do we retain, how do we recognize, and what can we do to move employee well-being to the top of the agenda. King Faisal, like other hospitals in the kingdom, continues to be a net importer of nurses. In fact, the whole of the kingdom is a net importer of nursing workforce. About 70% of our nurses are trained overseas. And so that leaves us particularly vulnerable in terms of what we do today, but also how do we manage to meet the workforce needs that are demanded by Vision 2030 within the next 5 to 10 years. I know, for example, that we are challenged to recruit something like 300,000 nurses into our workforce by 2025. Our current workforce today is just shy of 220,000. So you think about what that means in a 3-year window. That's a huge number, considering that the number of nurses that we graduate is somewhere in the region of about 10,000 every year. And as well as all of that, we have all of these challenges, and I think opportunities to extend healthcare beyond the 4 walls of the hospital. So as we start thinking about what that looks like in terms of healthcare, we're thinking about new models of care, care that is value-based, that is efficient, that is cost-effective, that is agile, and that is responsive to the needs of a growing population. And of course, we cannot at any point put at risk the quality and safety of care that we deliver and the safety of care that we provide to you as our nurses. So let's talk a little bit about Vision 2030 and the health sector transformation plan. There are 4 key themes within that. The first, of course, is facilitating access to services. The second is facilitating access to health services. The third is promoting the prevention of health risks. And the fourth is enhancing road traffic safety. All of these have implications not only for nursing numbers, but for the types of nursing that will be required to deliver Vision 2030. I think that Vision 2030 is both optimistic and it's ambitious, and it provides us with a wonderful opportunity, even at this point in time when we might feel our creativity is challenged and our vision is challenged, that Vision 2030 provides us with a great opportunity to really impact the care and service that we provide to patients in the kingdom. So when I think about what tools do we have today, because it's really easy to feel overwhelmed when presented with what seems like a huge challenge, and thinking about the fact that we're in a pandemic, we are not getting as many nurses from abroad, we need to grow many nurses in the kingdom, nurses and midwives actually in the kingdom. How do we actually do it? And I have found throughout my 31 years in healthcare that our nursing fundamentals serve us beautifully. And I don't mean to trivialize it by any means. I recall working in the private sector about a decade ago, about 15 years ago, and feeling completely overwhelmed because it was my first foray into the private sector, and I didn't have a clue as to what to do in terms of the portfolio that I had, which was marketing and communications. And I remember sitting at my desk one afternoon thinking about what tools did I actually have? And what I found that I had were all nursing fundamentals. The ability to assess a patient is the same ability to assess a situation. The ability to give a nursing diagnosis and to understand the implications of that diagnosis is exactly the ability that is required to solve some of the bigger problems, to diagnose what are some of our social and health problems that nursing needs to be addressing within the kingdom. the ability to plan what I was going to do once I knew the result of my assessment and my diagnosis, or my diagnostic, is that same ability that can be used at the bedside, at the clinic side, but can also be used to plan for workforce, to plan for training, to plan for the introduction of technology, to plan efficiency projects, to plan how we deliver care in every venue that requires it. And then, of course, the intervention. So those same fundamentals that serve us at the bedside that we think of as being so simple and so intuitive are also the fundamentals that will serve us well, I believe, in relation to Vision 2030. So what are the implications for nursing and midwifery? The implications are fourfold. There is an implication that we need to continue to deliver care that is very, very personal to the needs of our patients. Those patients might be in hospitals, they might be in primary care clinics, they might be in prisons, they might be in the armed forces, they might be in schools, they might be on a film set or at a tourist destination. But wherever there is the need for healthcare, we should have nurses. And that care that we deliver needs to be very personal. And at the same time, we also need to deliver care that is very local. We know from our use at King Faisal of the Crescent of Care model that different parts of the kingdom, for example, have different cultural and social needs that healthcare needs to be able to minister to in a very personal way, but also in a way that is very, it's very selective, if you like, to the needs of that local population. We know that particular parts of the country from our work in the UK, that particular localities have different types of diseases. So diabetes might be prevalent in one city or in one town, or cardiac failure might be prevalent in another. And so we need to deliver care that is both personal and local. And of course, 2030 gives us an opportunity and gives us the challenge, presents us the challenge of delivering nursing care and services at a national level. We are very much connected as a world. You know, we are in a global village, and if we didn't know it before, COVID has certainly taught us that we don't live on an island, and we cannot deal with some of the bigger challenges in healthcare as an island, that what we do impacts the world, and what happens in the world impacts us. And for that reason, I believe that Vision 2030 also gives us a challenge and an opportunity to impact global healthcare, whether that's in terms of workforce or research or new models of care, or whether it's in terms of academia, whether it's in terms of primary healthcare, how we connect using technology. Vision 2030 gives us a very much a global outlook in terms of how do we provide care in the kingdom that is of a global standard, that is benchmarkable against the best parts of the best organizations in the world. So how do we make this happen? One of the ways that we make this happen is to really be bold. I don't know how many of you have heard about the concept of 10x. The concept of 10x is about setting targets for ourselves that are 10 times greater than what we believe we can achieve. Yes, I know that this is really challenging right now because we all feel really quite tired. A lot of people are feeling burnt out. Some of you might be sitting in the audience and thinking, it's time to leave the profession. Nursing is just too much hard work. Midwifery is too hard. But 10x really challenges us to set goals that are 10 times greater than we think we can achieve. And then it means taking actions that are 10 times greater than what we believe are necessary to achieve our goals. So think about that. That's a huge ask, but for me, it's also an exciting challenge and something that I think if we can work together, we have the ability to achieve. But to do that, it's going to take a number of things that as nurses and midwives, we are great at and great at adopting. So first of all, it will require us to move at speed and at scale. And that means that not only are we moving quickly in our own organizations and our own local patch, but we're also scaling what we're doing to a national level. It requires us to be agile. We know for a fact that healthcare is a changing landscape. And the one thing that we know for sure, and the one thing that scientists and epidemiologists have told us, is that this will not be the last epidemic or pandemic that we go through. We know that the needs for healthcare can shift very quickly. And so as professions, it's important for us to be agile in terms of how we do that. The third, I think, is to be ambitious. It's easy to try to meet the goal. And believe me, I get it that some of us feel that we don't always have enough nurses, we don't always have enough resources to do what we need to do today, let alone to be ambitious. But it is important that we have an ambition that we take to the bedside and to the boardroom that helps us to elevate where we are today to the kind of healthcare that we will be capable of delivering and need to be capable of delivering through Vision 2030. And it means that we need to have courage. Courage is really important, and boldness, because there are many people who will tell us, and even our own self-doubts, or stinking thinking, as I tend to call it, will tell us that you can't do that. You can't make that happen. How are you going to get 70,000 nurses in 3 years? How are you going to have all of these new types of nursing? How are you going to provide healthcare that is local, national, and global at the same time? How are you going to get nurses to remain in the profession? How are you going to get advanced practice roles in the face of perhaps sometimes some local resistance? But it requires us to take courage. And again, that courage becomes stronger and strengthened when we're working together. As the singer Aloe Black says that, together we are stronger, right? We're better together. And I totally believe it. And then I think we need to have influence, and we need to use that influence to get the resources that we need and to argue for the things that we need in order to be able to deliver the kind of healthcare that we are capable of and want to be capable of. And this is where people like Dr. Mohammed and nurse leaders in this room and you at the bedside can advocate for what you need. But it does take that boldness to be able to speak up. And that same skill of speaking up that keeps patients safe at the bedside or in a clinic is the same skill of speaking up that actually helps us to get what we want at a strategic level. So 10X isn't just a strategy for the bedside, it is also a strategy for the boardroom. And when we create that clear line of sight between what we do in practice and what we do in strategy and operations, that's when we begin to get exponential results. So how do we do this? Because I know a lot of people will say, well, it's easy for you to talk about all of these esoteric concepts of, ambition and courage. And do you really understand what it's like at the bedside? Do you really understand how difficult it is to have influence? And I'd like to think that I do, because I have been both a practitioner and a strategist. I've run hospitals and I've worked with patients. I've worked in education. And many of the people I work with have had that same level of experience and built resilience over a period of time. But it's not just about me, and it's not just about you sitting in your chair. It's about all of us working together to get to Vision 2030. How do we do it? I think first of all is to embrace this moment in history. And I highlighted the word moment because a moment really is supposed to be a fleeting thing. And I think we feel through the pandemic that we've had a pretty long moment. But embrace this moment in history. We have learned a huge amount, as challenging as it has been. We have learned a huge amount. We have built resilience. We have begun to democratize the way that we provide learning for adults. It used to be that we provided all of our learning for nursing in the classroom. And now we have had to find that for adult learners, post-registration, and even some pre-registration courses, that we have been able to take some of that online. We have been able to use virtual and augmented realities where they exist, where that technology exists, to provide learning. So we have learned a lot. We've learned a lot about how we provide care for patients. We have learned a lot about not losing caring and losing that whole notion of the patient being at the center, even when we have had to provide services over the phone or using technologies. And of course, 2030 provides us, as I said, with both this sense of optimism and ambition, that there is support for us to do the very best that we can here in the kingdom. Remain focused on our fundamentals. I believe that these are what sustains us, that whatever nursing might look like now, between now and the next century, it is our fundamentals of caring or nursing ethics or skills in assessing and diagnosing and planning and intervening and reviewing. Those are the skills that keep us safe and sane at times like these. They are our sustaining pillars, if you like, that whatever is happening around us and wherever we need to go, keep us anchored in terms of why we're here. For many of us, it's about focusing on what's in front of us and what's ahead of us. So there is that focus on the foreground and on the future. Some people call it horizon scanning, but whatever you call it, we need to keep an eye on what is happening now and an eye on what is to come, and be traversing between the two as we do our work, because this isn't just about what nursing looks like today. We're not going to get to 80,000 more nurses by simply focusing on what we do today. We've got to do that by focusing on what healthcare is going to look like and how nursing is going to rise to that challenge. I would argue that advanced practitioner roles are going to be critical to how we become more efficient, how we provide care that is more accessible, how we provide care at scale to larger numbers of patients, and how we provide care that is both clinically appropriate, individually appropriate, and culturally appropriate. We know from the research on advanced practice roles that patients really value, from a patient's perspective, really value nurses who are in advanced roles for many, many reasons. But we have also seen that implementing those roles have resulted in significant cost reductions in many economies. In fact, there was a piece of research from the UK 2020 that said that cancer nurses in one locality led to a saving of something like £100 million. So think about that and the fact of how that kind of saving can be reinvested for the care of other patients and for the development of healthcare services. It is important for us to adopt and adapt to new and emerging technologies. The good news for us here in Saudi is that we're very technologically enabled in many places. And we have a young population who is pretty much au fait and pretty, very much normalized in terms of the use of technology in everyday lives. In fact, I heard somebody in banking say that young people in Saudi tend to live their lives, more of their lives online than offline. And so that provides us with a real opportunity in how quickly we can adopt new technologies and virtualize some of the work that we do today. We need to continue to provide solutions that are individual, local, national, and global, and really encourage and nurture genuine patient engagement. We know that when patients are engaged in their care, not only does the quality of service improve, but it also patients are more compliant with their treatment regimens. One thing that I think we lack here in sufficient depth is the strong commissioning and research and academic relationships between universities and healthcare providers. I believe that that is one of the ways in which we will strengthen what we are able to do in healthcare, so that universities, quite apart from just turning out students who are graduates, are really also part of the workforce planning landscape that needs to be there in order for us to be able to meet our workforce needs. They need to be working with the Ministry of Health and working with individual organizations in order to identify what do we need and how many and what kind of nurse do we need, what kind of midwife do we need, and develop programs that enable us to meet those needs, again, at speed and at scale and to the quality that is required. But also, the expertise in conducting research sits in the universities. I'm not saying that it doesn't sit in hospitals, of course it does. But much of that expertise sits in the universities. And there is a saying that if we can't measure what we do, then we're really never going to know how good we are or the impact of what we're doing. And so part of what we need to be able to do is, as we put these new solutions and strategies into place, is to be able to conduct research about what we do, how we do it, why we do it, to challenge some of the conventional thinking or some of the research that's sat out there for a long period of time, unchallenged or untested. And we need to future-proof our professions. First of all, we need to identify new routes into entry. Today, we have a very young profession, and I have nothing against youth. I love working with young people and the energy that comes from working with youth. But we also know in other countries that we have been able to create new routes to entry for people who were previous graduates of other professions, for mums and dads who perhaps are looking at second careers, for people who are in their 40s or 50s who might be thinking about nursing as a career but might feel that they're too old, but who have the academic qualifications or can attain the academic requirements to be great nurses. Retention and employee well-being need to move to the top of our agendas. It used to be that occupational health is what we talked about. It's a very kind of reactive solution to when people were burnt out, or they had a back injury or needle stick injury or splash injury, or had become too unwell to work. I would challenge all of us to move employee well-being to the top of our agendas, not just as a talking point, but also as a business point. Because if we cannot retain our staff, if we cannot help our nurses and our midwives to feel a sense of belonging and that we genuinely care about them, not just as workers, but as people, then the current trend of people leaving the profession will continue. It is important too for us to identify our future leaders and our current leaders and to nurture them, to coach them, to mentor them, and to grow them, and allow them to make mistakes. Because it is through the making of mistakes that creativity actually blossoms. We all talk about innovation, but innovation doesn't happen as a one-er. Innovation happens when we try and try again, and we finally come up with something that is so new and so unique that it has a disproportionate impact on a patient population or on our practice or on our finance or on efficiency or whatever we would like to call it. It's important too, I think, for us to demolish those artificial boundaries that sit between the public and the private sectors. We're all in the business of providing healthcare, and wherever patients are in the world, they deserve amazing healthcare. And sometimes that amazing healthcare might come from the private sector, and sometimes it might come from the government sector. There is enough work in healthcare for all of us to keep all of us in work for the next 100 years. So it's important for us, it's critical for us to demolish what I call those artificial boundaries between the public sector and the private sector. And then for us to continue to validate and identify new forms and types of nursing. So some of those new forms and types of nursing may include nursing that sits in, that works in a tourist industry, or nursing that works in a prison, or nursing that works in midwifery, or nursing that works, you know, in somewhere that is not conventional. I remember there was a time when my son would tell me that, you know, he didn't think I was a proper nurse anymore because I didn't wear a uniform, and also because I no longer worked in a hospital, I worked in technology. It's important for us to validate nursing that works in technology, in pharma, in research, in education, in management, in leadership, and in everywhere, in every venue that requires nursing. So I want to close by just sharing this quote from Theodore Roosevelt. Some of you might have seen it before, but I think it's very much a quote for our time. And I haven't put the whole quote here because part of it talks about failure. And I don't think this is an era in which we can afford to fail. And I don't think that 2030 sets us up for failure. I think it pretty much sets us up for success. But this is how we might be feeling right now. Some of us are pretty raw. And this thinking about how do we transform and how do we 10x and how do we take our moonshot right now might feel pretty raw and unrealistic to some of you. So I want to leave you with this quote. And it says, "It's not the critic who counts, not the man who points out how the strong man stumbled, or when the doer of deeds could have done better. The credit belongs to the man who is actually in the arena, whose face is marred by dust and sweat and blood, who strives valiantly, who errs and comes short again and again, who knows the great enthusiasms, the great devotions, and spends himself in a worthy cause, who at the best knows in the end the triumph of high achievement." I want to wish you all a wonderful conference, and I want to thank you for giving me this opportunity to share with you from afar, and I want to wish us all success. Thank you.
Thank you very much indeed. What amazes me is if you pay attention, every speaker talks about the importance of advanced practice nurse practitioners. Did you realize that? Yeah, I think it's it's time that we do action, right? It's time that we need to do some action, and hopefully that is going to be 2022. So. And that will be one of our recommendations. With no further ado, I would like to introduce you to Ms. May, Nursing Director, Jubail Health Network. She's been successfully leading the nursing department in Jubail Health Network, changing nursing practice and implementing the best practice for better future for of young nurses. I always like those who take care of the young. And the reason I'm saying that, we know nurses, they call that we eat our young, right? So take care of the young. Ms. May started out her career as a young staff nurse and worked her way up. Again, there's a few elements that attracts me when I hear. So she will receive her master's degree in healthcare administration. She's doing all the right thing. In her role, she was usually put in the position of mentoring, supervising, or creating plan for staff development along with her usual nursing duties. We have something to share. All of this, I like it. We thank you for that. In a world where everything is trained, May is the one constant. From her love of the healthcare provision to her empathetic nature as a driving force, she remains faithful in her abilities and passionate for the practice. To have the ability to embrace change and find the knowledge in yet to be followed is one of May's unique qualities. A strong communication skill and a kind soul have been May's asset in her long career, dedicated to serve. What a way to end for the conference. Please join me to welcome May.
Assalamu alaikum. Thank you, Dr. Abdelghani, for the nice introduction. And I would like also to thank the Saudi Nursing Association for giving me this opportunity to speak and present my speech here. Today, I'm here to talk about my experience and how I was developed from staff nurse to CNO. And I will present my experience at King Fahd Specialist Hospital in Dammam City during their journey to Magnet accreditation and how I was developed professionally through that journey. The first thing that I want to mention that any work environment that supports a culture of nursing teamwork and professionalism deserve recognition. The ANCC Magnet designation recognizes any organization's commitment to support nurses in their collaborative work and offering positive environment. The initial designation at King Fahd was received in 2020, but the journey started in 2015. To determine the readiness of the hospital, nursing survey was conducted as a part of a gap analysis to highlight opportunities related to the pathway standards. Each standard includes element of empirical outcomes that requires dedication and commitment. And also we have to present examples. So we appointed one team member to be a primary writer to bring together all of the examples and stories into a single document. Preparing the document for our designation, designation application presented some challenges, but with the teamwork, organizational support, and good communication, we overcome these challenges. To find strong AOP examples from diverse areas and ensure they adequately supported each standard required working as a team with members and who represented different areas of the organization. Directors and managers supported nurses' effort, giving them time during work and allowing them to work on the project from home with offering time back to them. Also, another challenge was finding the right person to gather the information for and complete the organizational demographic form. We worked with data analysis and who supported the senior leadership team to run reports for the necessary information. When the information required enhancement and future investigation, the Magnet coordinator, who was the primary writer, took on this task and filled all the details. In some cases, we had difficulty receiving timely response to request for information, but we remained respectful of competing and completing priorities for everyone's time. But when necessary, we escalated requests to directors or the chief nursing officer to help generate new support. We found the more we shared about the program, the more cooperation we received. Our professional nurses, Nurse Clinical Practice Council, the members at these councils reported our progress to the nurses on their units, shared examples, and we still needed, if we still needed to complete some of the applications, they will share it with the staff. And they explained very well to the staff the standards. To prepare also all nurses for the RN survey, that was a huge challenge. But we reminded all the nurses of the wonderful patient care they provided and how the hospital supports a positive nursing environment. When the document was submitted for review and approved by the ANCC, the nursing staff was asked to complete also the another RN survey to validate the written application with the EOPs. To ensure we met the percentage of responses, we assured our nurses The survey was anonymous and let them know how important it was for everyone to participate, and also to encourage participation. We make it fun environment for the nurses, and we make the RN survey also a fun event. So we offered the units who was highly responded and participated in the survey with a free pizza. So that encouraged all the nurses to participate. When KFSHD first applied for magnet designation, they were required to submit elements of empirical outcomes for all standards. When they began the process for applying for designation, the standard had been streamlined with structural empowerment, exemplary professional practice, new knowledge, innovation and improvement, transformational leadership. Yes, we experienced challenges during our journey, but we learned lessons about communication, timeliness, teamwork, and sharing the application process with the nurses with broadened their perspective about how our organization provide opportunities for growth, supports work-life balance, and allow nurses to flourish as professionals. When I joined KFSH, I joined them as a brand new manager, nurse manager for medical imaging department. And after 1 year, the organization started to add more tasks to me, more departments, in order to prepare me for the next level as a director. So in 2020, I was assigned as a director for medical neuroscience nursing. And then 2021, I was appointed to be a director for nursing in Jubail Health Network. During my journey, I was working with so many people who kept mentoring me and giving me advices. So, the steps for success, to be a successful leader, first thing, succession plan must be the top priority for any organization. Nursing leadership is a key part of every unit. So the staff and patient satisfaction, quality outcomes, and even financial status correlate with the strong nurse leaders. So the question is how to become an effective leader. While leaders might come from inside and outside organizations, nurses more often move from staff role into leader positions within their own organization. And we cannot underestimate the knowledge and the experience that comes from the staff. However, without guidance and direction on the qualities and expectation of a leader, success will be difficult. Steps to succeed in the transition are outlined in the next slide. So, we need to be prepared. The transition from staff nurse to a leader will redefine the person's role on the department. Moving to the role of a leader may let you face some challenges in changing relationship with your core worker. You might find some staff try to use their previous relationship with you to get special treatment, such as scheduling or patient assignment. Others think they are not subjected to disciplinary action. The staff will take the opportunity to test you. If you expected this overcoming will be easy for this challenge. The staff members and you as new leader need to work together to establish trust and respect as a new relationship will be developed. No specific strategy exists to reduce the stress of these personal transition, but the best way to decrease the stress is by setting new boundaries from the beginning. Consistency must be the initial transition period. Treating everyone equally, regardless of the relationship or previous friendship, is the key to set clear expectation. Once the staff realize that the new leader is holding everyone accountable to the same rules, they will respect your growing leadership qualities. Then, communication is the key to successful build a trust relationship between you as a leader and your staff members. The staff need to understand their new leader support them and is open and honest, asking the staff for their input on everything from budgets to policies will add coherency to the department. In return, the leader needs to communicate regularly and consistently with the staff. Using different methods to maintain the channel of communication is necessary. In engaging the staff as many as possible through emails or weekly updates, unit meetings, or informal conversation. The staff need to interact with the new leaders as often as they can, so they can adapt to their new role in the same way the leader is adapting. Instead of communicating on peer-to-peer level, new leaders need also to communicate on employer-to-employee level. This change in communication needs time to adjust. The communication a new leader receives from supervisors plays an important role in development as well. Taking time to clarify and define the expectation of leadership position is important in order to succeed. New leaders need to recognize, just as staff nurses prioritize patient care, leaders must also prioritize and communicate needs to their supervisors. A new leader can feel overwhelmed at times, but maintaining self-awareness and communicating needs will turn the difficulty to learning opportunities. Finally, as leaders, we need to get a support group. So the final key aspect of transitioning to a nurse leader role is having a strong support system and mentor. Many nurses have transitioned successfully into leadership role, and they can offer guidance and experience. The new leader should select a mentor who offers support, encouragement, and educational guidance in non-judgmental and caring way. When difficult situations emerge, colleagues can serve as a resource to develop a plan of action. Regular meetings with the mentor will help make a smooth transition to nurse leader. Mentors are important in building confidence among new leaders, and the new leaders need to feel empowered to try new ideas and concepts without fear to fail, and realize without failure, learning doesn't occur. Experience must be shared honestly with your mentor, while keeping an open mind to offered advice. The role of a nurse leader is not different. Although a nurse may have many years of professional experience, transitioning from a staff nurse to a nurse leader provides a challenging experience. By setting boundaries as a priority and selecting mentor, the new nurse leader will become effective and successful. Finally, I would like to take this opportunity to thank the people who really believed in me and who developed me, Ms. Mawahib Moang, is the one who found me, and she plays a huge role in my career pathway. And Mr. Abdullah Ngala is the one who assigned himself a responsible person to mentor me, and he was always dedicating time for me. Until yesterday, he was dedicating time for me between the sessions just to provide me a small session. And finally, those are my team, the one that I couldn't work without them and I couldn't reach anywhere. They really trust me. And in some points, I felt they are leading me. And other points, I felt we worked in parallel. And some points, they were pushing me up. So thank you all.
Wow, thank you very much. What a way to close for the conference. Thank you so much. Yeah, no, it's still question and answers if they have any question. Indeed, we have a very stimulating sessions, civility, culture of civility. Very important work health environment. Two very unique talk from Ms. Abrar and Ms. May, and very inspiring talk from Dr. Kathy. So the questions, anybody has a question, comments, please, you're welcome. For Teresa, are you with us?
Yes, I'm still here. Thank you.
Still awake. Thank you so
Yes,
much.
I am.
And Kathy is there.
Yes, I'm here.
Oh, you have a question? Go ahead. Somebody has a question? Fatima.
Thank you for the nice presentation, both of you, May and Abrar. And my question goes to Abrar. I was so impressed by your presentation and your journey. The one question I have for you is, what makes you decide to leave quality and go back to nursing? You know, sometimes we notice the vice versa happen, where nurses are more encouraged to go to quality. And I'm sure you have a big reason. Thank you.
Thank you for the question. As I said, for me, I'm looking to be really influencing leader in healthcare. I have always aimed to visualize the healthcare system in Saudi Arabia to be one of the best care delivery system in the region and even worldwide. And for me to achieve my professional goal, I have to take a brave decision and to have a great exposure and learn from those people who are actually making the change. My experience in quality was very fruitful. I learned a lot. It really gave me the foundation to work in any healthcare management role. But being there, away from those people who are running the business, you're gonna lose a lot. And you're gonna miss a lot when it comes to real healthcare management principles, skills. It will never be built by being just documenting what has been achieved by others. So this is my answer to your questions, and I hope it really answered your concern. Thank you.
Indeed, very inspirational. Abdullah.
For me, it's not just a question, it's just a celebration, like I've always mentioned. Alhamdulillah, I'm very proud to say within 2 years, we have 4 Saudi directors. And they're all doing extremely well. So from only 20%, we went to 80% directors of nursing. So this is really, and really performing directors of nursing. one even out of nursing, and she's proud to be with us. May is one of those. She's even exceeded now. She's director of a network. So this is really achievable, not because of me or because of only one person. It's because of teamwork and the spirit within the team. So we're really happy and thank you all, and we're really grateful for this achievement.
Thank you, Mr. Abdullah.
Thank you very much. I like to acknowledge they call mother of all. I think all of this success is behind somebody called Miss Mawa. Boy, do you want me to mention your name? No, I'll just kind of finish. I want to acknowledge. She doesn't want it to be mentioned, but I know the history. When Mawahib was working in King Fahad. So for that, just you need to know. So go, Mawahib.
Thank you. Thank you, Dr. Abdi. Mike, I want to say a sentence and then I'm going to ask May a question. My sentence is to all nurses. The sky is the limit, like Abrar said. The opportunities in nursing is so huge. There is no reason for any nurse to leave nursing. Please do not leave your profession, but instead grow within your profession and advance it. We need every single nurse. So my question for May, as a young Saudi nurse who started from the bottom and went all the way up as a CNO now for a hospital, what would you say is the biggest challenge for you that you have faced in reaching that?
The biggest challenge that I faced, just to keep yourself motivated. At some point in my life, that when I was a young nurse, I thought that I was a dreamer because I received so many comments from others that you're not going to change the world. The world has been found like this. What are you doing? So I thought that I was a dreamer. So I decided just to stop and do my daily work and just go home, be happy, and that's it. So one day, I still remember that day when I met you and you told me, what are you doing there? You just go, you have to go and to move to a critical care department. And that was a huge change in my life. I felt that I has now a huge duty also to develop new young nurses, to keep them inspired and keep them also motivated and protect them.
I have one question for Dr. Kathy and one comment or for Ms. Teresa. I think she covered everything. When it comes to civility and work health environment, this is very sensitive issue. Oh, you have, I will let you know. But let me just finish this comment, it's very crucial. In addition, all other factors that contributing to what we are facing we do it to ourselves. We are not taking care of each other, okay? For many reasons, as a leader from top to the bottom. So please speak out, nurses, be assertive. You don't work for anybody. You don't work, anybody works for the institution. You get it? I've been told at one point, you work for me. My director told me, hello, I don't work for you. We work for the institution. Speak up and critical thinking. My question to Kathy, Kathy, now as a CNO, you have a great opportunity. When it comes to ABN, do you have any initiatives or any plan in King Faisal at Jeddah?
Thank you for that question. And yes, absolutely, we have plans for advanced practice in Jeddah. I'm a huge advocate for advanced practice. Having practiced as a nurse consultant, I totally get the value of what advanced practitioners do. But as I said, I also feel it's the way that we can contribute to health services at speed and at scale in our local organizations as well as nationally and internationally. And it's also a great mechanism for Saudiization. I think we're seeing in Saudi what we saw in the UK and other geographies, which is people get to a certain level in their practice and they feel like there is nowhere for them to go, like there is a glass ceiling, or they've really reached the limit of the sky. And many want to remain in practice, but we don't have a formal mechanism for them to do so and to be rewarded for their knowledge and their skills and experience. So I think advanced practice is a win-win for patients. It's a win-win for the profession. It's a win-win for the country and Vision 2030. It's a win-win for the globe. Our plan this year is to resume our scholarship program so that we can get a number of our nurses out to master's and PhD programs. We are also going to be credentialing those people who already have specialist or advanced practice titles in our organization against our specific credentialing framework. And obviously a big part of our plan is really to begin to make an impact on some of the bigger priorities like patient access, like efficiency, like cost, and moving, as I said, care outside the four walls of the hospital. And we will be delighted to share some of that experience with colleagues in the room. And I know that Riyadh already has a program in place as well. So the answer to your question is yes, absolutely.
Thank you very much. Question here?
Yes, good afternoon to all. Thank you for this informative, inspired, and motivated presentation, Ms. May and Sabrar. It is my pleasure, and it is a huge opportunity for us and Jubail Health Network to have a new leadership style, a new young nurses. I, as a chief nursing officer or director of nursing, it is really start and beginning toward the vision of 2030 for the Kingdom of Saudi Arabia. Ms. May, if you are a dreamer, okay, and you can achieve your dream to make it your goal, just keep dreaming, please. Thank you. And you have support.
Thank you very much. Thank you very much. Dr. Muhammad Al-Ghamdi, it's time for us to distribute the certificates, and then Dr. Muhammad is prior to that. Can you make the workshop bigger? The screen for the workshop? Yeah, so those of you who register, can you make the box? You focusing me? Anyway, so the first conference will be Riyadh Hall here, okay? That's 8 p.m. The second conference, Empowering, will be Abha Hall. All the rest will be same. You will be guided. It's the first floor. Abha Hall, Hail, Medina, and Qasim. And I believe there is still opportunity for 3 workshops. Number 3, number 4, and number 5. And if you have any question or clarification, you can always come to us. The other announcement, after lunch, everybody will come back here, okay? There is some just the program. We're gonna have the closing and the recommendation, okay? Very important. You all to be here during that period, so to know exactly the outcome of the conference. Without further ado, Dr. Muhammad, if you don't mind, distributing the certificates to the speakers. I know that this is for
Thank you. Thank you so much. Yes. I can hear you.
Thank you so much.
Thank you so much.
Ms. Abrar, please. Miss May, thank you so much. Kathy. Dr. thank you very much. Looking forward.
Thank you very much. Appreciate you.
You're welcome. Thank you. That concludes for the session. So have a good lunch. 1 hour. We all meet here. Thank you. Thank you so much.
ما يطاولنا سحاب ولا عزوم تردنا تنطفي وتضوي نجوم وما وصلنا حدنا. ما يطاولنا سحاب ولا عزوم تردنا تنطفي وتضوي نجوم وما وصلنا حدنا. ومن بغى يعرف مدانا وين، من بغى يعرف مدانا وين، يسمع ردنا. ما لنا آخر حدنا متن السماء. ما لنا آخر مدنا غيث انهما. ما لنا آخر حدنا متن السماء. السماء درب العسير ومن سوانا يسلك للعدو سيف شطير وللخويف نبركا. للتواد درب العسير ومن سوانا يسلك للعدو سيف شطير وللخويف نبركا. بشر الدنيا بخير دام، بشر الدنيا بخير دام فيها المملكة. ما لنا آخر وين ما هب الهوى. ما لنا آخر نصعد العالية سوا. نشوتك عرضت سيوف من ذرى سعف النخيل ونكش حنا في الكفوف. لين صار المستحيل الشعب، لين صار المستحيل الشعب. هذا اللي تشوف. ما لنا آخر ما بها منه لحد. ما لنا آخر حاكم وشعب وبلد. ما لنا آخر ما بها منه لحد. ما لنا آخر حاكم وشعب وبلد. وما لنا آخر.
2030 تضعنا في موقع متقدم جدا في العالم، لكن 2040 سوف تكون مرحلة المنافسة عالميا.
شايفينك حلمنا بعيوننا حافرين اسمك وسط قلوبنا حظ عين الحر هايم في سماك ولا نزل على الأرض أرضك موطنا أرضك موطنا أرضك موطنا عاشقينك من دفا الصحراء إلى عالي الجبال وعاشقينك من وجوه الطيب لنخيل الظلال وعاشقينك أجمل أرض وأجمل من خيال وعاشقينك شايفينك قصة في بيت طين عن غلا التاريخ واهل الاولين تمرة من نجد وفنجالك هوا ومع دخون العود ياخذنا الحنين ياخذنا الحنين وياخذنا الحنين عاشقينك من براري حايل وشبة غضا عاشقينك من سهر جدة وبحرها في مساء عاشقينك عاشقينك شبة غضا عاشقينك بهجة في الحياة وعاشقينك شايفينك مجد جينا نكمله من شواطن يوم لانوار العلا كل خير كان من ارضك كريم وكان بير الخير راعي الاولا راعي الاولا راعي الاولا وعاشقينك بالرياض اللي لنا الحضن الكبير وعاشقينك جسر شرقية إلى سودة عسير وعاشقينك عاشقينك يا الرياض عاشقينك يا وطننا وانت يا وطننا وانت الأول والأخير شايفينك حلمنا بعيوننا حافرين اسمك وسط قلوبنا حظ عين الحر هايم في سماك ولا نزل على الأرض أرضك موطنا أرضك موطنا أرضك موطنا عاشقينك من دفا الصحراء إلى عالي الجبال وعاشقينك من وجوه الطيب أجمل أرض وأجمل من خيال وعاشقينك. شايفينك قصة في بيت طين عن غلا التاريخ وأهل الأولين، تمرة من نجد وفنجالك هوا، ومع دخون العود ياخذنا الحنين، ياخذنا الحنين وياخذنا الحنين. عاشقينك من براري حايل وشبة غضا، عاشقينك من سهر جدة وبحرها في مساء، عاشقينك عاشقينك شبة غضا، عاشقينك يا وطننا وانت، يا وطننا وانت بهجة في الحياة وعاشقينك. شايفينك مجد جينا نكمله من شواطن يوم لانوار العلا، كل خير كان من ارضك كريم، وكان بير الخير راعي الاولا، راعي الاولا، راعي الاولا. وعاشقينك بالرياض اللي لنا الحضن الكبير، وعاشقينك جسر شرقية إلى سودة عسير، وعاشقينك عاشقينك يا الرياض، عاشقينك يا وطننا وانت، يا وطننا وانت الأول والأخير، الأخير عاشقينك. قدام ما نرجع ورا طبع السعودي، من قدم راح علم اللي ما درى بارواحنا نفدى العالم. قدام ما نرجع ورا راح علم اللي ما درى بارواحنا نفدى العالم. راح من اللي